So I think we're good to start. We might have some tech issues since we're kind of jumping around on slower computers today, but we should be okay. Let's start. First off, everyone that's in here, here's the Wi-Fi information. You may still have been signed in or have the at least the account info from your trainings previously. If you still need it after we move past this, we do have it up on the wall in, I think, 3 places, but they're all tucked in the corners and on the back wall. So feel free to get up to walk over to see it. First, before we begin, I suppose, do we do introductions? It feels odd to start a presentation without introductions.
Do introductions.
Let's do introductions because I think Rebecca, Christine, and I know everyone in here, but not everyone in here knows everyone else in here. So we'll start, and I guess we'll go first, and then I'll pick on Julia to start it off for the volunteers. Hi, good morning. I'm Jordan. I'm the volunteer coordinator. It's great to see you. You're all my very, very favorite people. So thank you for spending your morning with me. I appreciate you all so much.
Good morning. I'm Christine Mather. I'm the Medicare Counseling Coordinator, and I echo Jordan. You know how much I love all of you and how we couldn't possibly help people if it weren't for your help. Thank you so much for spending time with us today.
Rebecca's off printing, so we'll circle back to her, but I'll pass it to Julia now.
Hello, everyone. My name is Julia Mancini. Very excited to be here. I currently work at a home health company doing provider contracting. So know a lot about payers and how confusing Medicare can be. So that's part of why I went through the August cohort group. So a recently new Medicare volunteer.
Hi, my name is Alicia Slaughter, and I too am a new Medicare counselor. Went through the same cohort as Julia. I'm a retired technology professional, if that's the right word. And so, and I'll be approaching Medicare age shortly. So it's a little self-serving, but also too, I recognize how difficult, and you use those words, Medicare, to anybody, young, old, or whatever, and they're like, oh, it's terrible. I'm not looking forward to it. So, so I thought, oh, this would be a great way to help the community as well as some of my friends and families, even across the country. I've told them about their SHIP program, so it's been helpful.
I'm Trish Root, and I think I'm still in training for counselor. And I'm retired about 6 years now, so I've forgotten how to work and drive here in traffic. God, almost killed me this morning. And I was an HR comp and ben for most of my career.
My name's Nancy Parker. I'm a retired nurse certified case manager. My initial training was in August of 2013, and I've been doing it for a long time. I've literally been working with Medicare since the 70s. So I've been around it my whole career.
Hi, everybody. I'm Ray Dawes. I've been counseling a while. I enjoy it.
Hi, I'm Tom Hanks. I've been doing this for a little bit of time. I'm mostly retired, a health plan executive.
Bob Nardini. I'm completely retired, and I've been with SHIP for about 3 years.
Sarah Galvaro, retired employment lawyer, and I'm a fresh one too.
I'm Beth Luongo, and I was certified back in January. I come from Connecticut, and my prior job was with a social worker, and I saw how much good she did for everybody that walked in her office, helping anybody with Medicare. So I decided I'd throw my hat in and try it myself.
Beth, would you mind to start sending down the sign-up sheet?
Rebecca just took it.
Grabbed it.
That's okay.
All right, and then Steve, would you go next, and then Tom, Rin?
Sure. Steve Lasher. I'm a retired Motorola security engineer. When I retired and started looking at Medicare, I realized what a daunting subject it is. So I dived into it, and then I just love it. So I like to teach, and I'm glad to be part of this group.
I'm Tom Wren. I'm a retired property and casualty insurance underwriter, and I have been a counselor for 5 years, enjoyed immensely, and feel like I'm working with a great group, that's for sure.
Well, thank you. Okay, so I'm gonna start, oh, actually, no, I won't start because Rebecca's not yet gone. Would you introduce yourself?
Oh, yes. I'm Rebecca Nofi, Volunteer and Community Engagement Manager here at GNRC, and I'm thrilled to have you all here, especially after a somewhat disappointing last week. So it's really nice to have you all here again. Thank you for hanging with us through all the hurdles, ups and downs, bad experiences. I'm always, amazed at how you all keep with it, even though it's sometimes challenging. So thank you. That back that way. Not everybody had.
Sure. Okay, so now we'll start for real by saying thank you all. This group does phenomenal things for our community. I mean, really seriously good work. I like numbers. I'm a numbers guy, so I brought some numbers. Don't be surprised if I do it again later. Last year in counseling alone, so this doesn't go for leaving messages or sending emails. It doesn't go for travel time for events, but just one-on-one speaking with a beneficiary. True volunteers gave about 570 hours between October 15th and December 7th, which is huge. The number that we can report that we've saved the GNRC region is $416,000 and change, which for the beneficiaries that we helped enroll breaks down to be more than $2,400 each. But our actual impact is way higher than that because we do a lot of plan comparisons and then send people off to consider things and then enroll themselves. So I really have no way to guess how much we are actually impacting. But when we do the enrollment, we can claim $416,000, which is a lot for people that are on limited incomes. Typically, that's a good number of our plan comparisons. So this could not be done without all of you and the time you give us and the energy you spend coming to trainings like this and figuring out the complexities of Medicare and all that fun stuff. So thank you again so much for being here with us.
Thank you. I'm going to be saying thank you a lot because I really appreciate all of you. And one thing that I wanted to make very clear from the beginning that Jordan and I wanted you to know is that this is volunteer work and we understand that. And we realize that there are some things that are not fun for you to do. Now, some of them are a little harder to get around than others, like data entry, but even that, if it's not something you're comfortable with, we can work it out. So we want you to know that we respect your energy and efforts, and we want you to feel like you can do your best work. That means that what we expect from you is not that you do everything, but that you do the things that you think can make a difference and that you enjoy doing. So we want to talk a little bit about not feeling pressured. We had last week a somewhat, for me at least, confusing presentation that made it seem almost as if you had to be a medical expert in order to do this volunteer work. You do not. There are many, many things that we don't expect you to know, and you can always consult Rebecca, Jordan, or myself. Don't feel pressured to enroll people in a plan if that's not something you're comfortable doing. If you're not sure of the process and you want to enroll people into a plan, consult Jordan and myself. We can give you additional training if it's something you want to do. Let us know if there's some kind of counseling that you don't want to do. And of course, those of you who are doing phone counseling, you can somewhat pick and choose, but sometimes when you're on the phone with that person, it may turn out that it goes into an area you're not comfortable with. For instance, doing a Medicare savings plan application. If you're not comfortable with that, you can say to the person you're working with, I really think that you should apply for this. Would it be okay with you if I connected you with a specialist? And then you can either give it to Jordan or myself, or we might further farm it out depending on what's going on. But you don't have to feel that there's any specific type of counseling that you have to do if you are not comfortable doing it. If anything comes up, if you are talking to somebody and maybe they're a long talker and it's been an hour and a half and you have to leave for Florida or Hawaii or Tripoli the next day, then absolutely just let us know what happened. Say, I'm so sorry, I'm going to have to let you go for now. But I would love to get you in touch with another counselor who can pick up where we left off. And we will absolutely be happy to do that. Just email the three of us and we can take that over. If you want to attend an event, but you're not sure that you're ready to be a counselor, we're having all of these events coming up. Still, you can still attend it. Just let us know. We can sort of create a slot for you, particularly if you're willing to set up accounts in Medicare.gov. Usually if somebody's not ready to do plan comparison counseling, but they are able to attend an event, what we would ask is make sure that you're ready to set up a Medicare.gov account with them or help them put medications into an existing Medicare.gov account. And that's a huge help. If the person is all set up with that account when they sit down to do a comparison with us, then that's so much quicker. So there are absolutely so many different ways you can help. Don't feel constrained to do something that you're not comfortable doing. We are just happy that you want to help others and we want to help you do that. I think that's pretty much it. Does anybody have any questions about expectations of the program?
All right, let's get started. We're going to start looking at plan worksheets. If you're in person, you've got that in your packet.
And for those who are online, I just emailed the presentation. So if you want to take notes or something, you have it in your inbox. Anybody, send it to everyone.
Did I give you one? Oh my gosh. I'm so sorry. I'm done.
Thank you.
There you go. All right, these should be relatively familiar to everyone, but we're gonna just touch base on them because these worksheets have changes from last year. We're also gonna touch base because some of you might not want to do in-person counseling or phone counseling and may just want to process some of the worksheets that we get sent to us, either through email or through fax or sometimes through the mail, which we get a good number of. At the top, we have the general demographic information, which is really just useful to get things back to people. And also we need some information for Medicare.gov account creation. If you are doing counseling face-to-face or over the phone with someone, when we're working with them, their username and their password is whatever their preference is going to be. So we ask them, what would you like to use? If they don't already have a username and password and you're doing something based off of the worksheet and not counseling face-to-face, then we have a scheme that we use for the username and password that's on the PowerPoint, and we'll look at that in a moment. Of course, we will need their Medicare number to make an account online for them, and for just about all of the plan comparisons, we'll be making an account for them. There are some where they just really prefer not to. Humorously, one time last year, I was told that they didn't want an account because they didn't want the government knowing what they were doing, which I think is very funny when it comes to Medicare because the government has a little hand in Medicare. There are some questions here that we ask to make sure that we are getting a complete picture of the person's coverage before we do a plan comparison. Really important one is extra help. Do pay attention to that because that can have some serious impacts on somebody's drug costs, of course. It's going to ask if they have a Part D plan and if that is an Advantage plan. Rather, it's going to ask if they've got drug coverage. And they should give us the name of their current plan. If not, we should be able to see that when we do the plan comparison inside their account on Medicare.gov. When we're doing a plan comparison, we should be including the plan that they have now, just to reassure them that whatever they're getting or whatever they're looking at is correct when we're comparing it to their current plan. Now, if they're going from Advantage plan to a Part D plan, you might have to toggle those back and forth and just save the PDF of whichever they're leaving, because you can't do a side-by-side comparison for Part D and Advantage. It doesn't allow that, which makes sense, a little silly. And then they'll tell us how they want their comparison, if it's going to be emailed or posted back. It's going to ask here at the top of the back page if they want to be contacted for low income assistance. Pretty self-explanatory there. If they say yes, then when we follow up, we'll probably do the low income subsidy application, which takes 10 to 15 minutes online. If you're comfortable doing that, if not, flag it up to somebody else and we'll be able to assist with it. And then the really important stuff. Most people that want a plan comparison are on prescription medications, so they'll probably choose yes here, and they'll give us the pharmacy and the location. The location's less important. Any pharmacy in the same area is going to have the same coverage. So if they say, I go to the Walgreens on Sesame Street, we can say, so sorry, we don't see that one, but we can choose the Walgreens on, I don't know, Elm Street. I guess it's October now. I can use Halloween references. Yes. And then they'll give us the information on their medication. This is where we usually encounter the hiccups, because people will say, oh, I take, like in this example, metoprolol, but they won't say if they're in succinate or in tartrate. So if something on the plan comparison just doesn't have all of the information that you need, our first step should be calling the beneficiary, explaining that we're working on their comparison and asking them to give us the full details, because we want to make sure that whatever plan we're looking at is actually going to help them. And we can't do that without details. All right, any questions on the worksheet? Yes.
So for people who might be doing plan comparisons
Uh-huh.
at home on their own laptop, is there, I mean, the fact that we've got that Medicare number and we're setting up accounts for, is there?
Oh, that's a really good. Yes, so we are able to send things in a secure email, which I don't believe that we've set up yet. But one of the things I'd like to do in the next 2 weeks is for everyone that doesn't have access to the SHIP Volunteer secure email, I'd like to schedule a meeting to go over that and give you access so that there wouldn't be any conflict. Now, as far as doing things on your computer, that's okay. But once you do the stars entry and put the plan comparison information in stars, which we can go over again, then you would delete that off of your laptop. Yeah, so it's a good point. If you're using a personal machine, try not to keep the important information on it. Delete it as soon as you can. All right, let me navigate back to the PowerPoint. Oh, but I see we have somebody else online now. Hi, Leanne. How are you?
Looks like you're mute.
Good morning, everyone. How are you?
Doing well, thank you. All right. So this is the scheme that I was talking about earlier with the account creation. If they do not already have an account and they aren't there to answer questions about what they'd like to do for their username and password, then we prefer to use their email if it's available. If not, we'll follow the convention of using their first initial, last name, an exclamation point, and the number 1. For their password, of course, we default to whatever their preference is if they're available to ask. But if they aren't, then we're going to default to Tennessee, or I guess TN for Tennessee, SHIP, assist, exclamation point, and number 1. That helps us out in subsequent years when they contact us by mail or email again and say, hey, I'd like another plan comparison, but I've got no idea what my username and password is. You guys did this for us last year. Then we've got a good idea of what it might be, which helps with account recovery. When it asks the secret question for account recovery purposes, we try to do favorite vacation spot, not available to give us their preference, of course. And then the answer to that is Nashville. And then it's incredibly important that we put that information back on the worksheet so that we can send it to them so they have it for reference for next year. Now, as far as plan comparisons go, Do you remember that most over-the-counter medications are not included? So ibuprofen and acetaminophen. There are some exceptions to that. And sometimes someone will get a prescription for what seems like an over-the-counter medication, but it's not being used in an over-the-counter way. I think one we had last year was, actually maybe Nancy, you'll know this. Potassium for a heart issue, usually considered a supplement, but might be prescribed.
Potassium chloride is frequently used with hearts, yes.
Okay.
Yes, it's a supplement, but no, that is
Right.
generally covered.
So sometimes we'll see supplements like that. Potassium, ferrous sulfate, we saw a few times. Just make it clear to the beneficiary that we're not able to find that on Plan Finder and that it's probably going to be considered over the counter. Most people are return customers, so they'll understand that.
We do have a letter for you to send, and I think it actually says that in the letter.
Mhm.
And there are some prescription medications that, unless they've added it to the database in the past, simply are not in the database. And I just tell people, I'm sorry, it's not coming up in the database, so I can't add it. I'll send you everything else. If you've got any questions on it, then call the plan.
Yeah.
Because if Medicare hasn't put it in there, our hands are tied.
So there is no way to add anything that's not.
It's not in the
database?
Medicare database, no.
No, if it's not been loaded on Medicare.gov, there's no way to get an estimate for it.
Gotcha,
So just do the best that you can and then continue.
gotcha. Yep, I just thought if there's a place to just put notes, could stick it in there or something. I don't know.
I don't think there's a place for notes in Medicare.gov,
Okay.
but when you're sending this back to somebody, you can certainly add a note and say, hey, we weren't able to see this. Big thing for this year that we're probably going to get a lot of questions about is that the coverage gap has disappeared. The donut hole is completely gone. We go from the deductible phase to the initial phase directly to catastrophic coverage at $2,000 copay. Now, it is incredibly important that we stress that this is for covered medications only. So if someone is on a plan that does not cover a medication, then the money they spend for that medication will not go towards that $2,000 cap, as we understand it. It's entirely separate, which means that this year, maybe more importantly than any other year, it is important for someone to do a plan comparison because so many benefits are now being offered for covered drugs and covered drugs only. We'll talk about more later. And actually, Rebecca shared an article with us earlier this week, last week. I forget, the days are running together.
This week.
Some point.
Where something like 80% of Medicare beneficiaries are not doing a plan comparison every year. They just let things ride, which I'm really worried about because about 25% of the Part D plans in this area are no longer available next year. So I don't know.
Can I give a real life example? This is within the last couple of months. 2 different occasions. I talked to 2 different beneficiaries. One of them, I look back, he hadn't changed his plan since 2011. I'm like, okay. Both of them were paying over $100 a month for their pharmacy plan, which is, again, at the higher end. Looking at the plans at that time, they both qualified for Medicare or for WellCare value script at 50 cents a month. I've got them on a list. They are getting a phone call. And I said, no, and I have been yelling it to everybody. I actually put a thing on my Facebook. People compare plans of all years, this year's. You've got to compare plans.
All right. And then when we're emailing back these comparisons for those people that wanted emailed, we will be using not the personal accounts. So never use your personal email to send information that's protected. Please use the SHIP volunteer account. And for those people who have not yet seen that, haven't had a chance to train on that, I've got 2 weeks where you're my priority. So we will get that training done and everyone can be comfortable with it. If they want it printed and mailed out and you're working from home, then you can email it to our great admin team here at adminsupportteam@gnrc.org, and then they'll take care of the rest. They're amazing. Please remember to say thank you 1,000 times in any email you send to them. They bend over backwards for us. In fact, they got the coffee and the donuts and everything this morning. So Thank them. But of course, make sure that we're giving the address and then your name or initials to send on to people. Oh, thank you. I see. Hello, June.
Hello.
Okay. What I'm going to do now is talk about the documents that we need when we do a plan comparison. Most of this is going to be familiar to people because I think most of the people in this room either trained this year or have done a refresher this year or do this all the time. But if anything that I'm talking about doesn't make sense and you want more opportunity for practice, we do have practice worksheets that I can send you so that you can hone these skills and try to get these documents and then send them back to me for comparison, just so that by the time you actually work with the proper beneficiary, you'll know what the process feels like and you won't be nervous or unprepared or anything. So feel free to let me know if you want to practice and I can send those to you. What I want to do is go over this, and then we're going to do a little practice in Medicare.gov. But when we are helping somebody enroll in a plan, we need a number of documents. We need to save the PDF of their current plan if they keep it for year 2025. So if someone is going from one plan and then enrolling in a different plan, we're going to look at the hypothetical situation of what if they kept the plan they have in 2024 for next year and see what those costs could have been, because that's where we get the cost saving measures from. We see what would they have paid if they didn't have SHIP's help. So we'll save a full PDF of that detail. We also need to save the full plan PDF of the plan that they are choosing. So when they're switching over from one plan to another, we need to know what their actual costs for 2025 are, or at least the estimated costs that we have available to us now. And then also when we do the enrollment, we need to be extra sure, excuse me, to get the last page of the process. There is a section where we'll have you review the application. We don't need a PDF of that. But once you actually say that you're submitting the application and you click the blue enroll button, it'll take you to a next page. It says you're all set. It'll have the plan's name on it, and we need to save a PDF of that as well. So let's go over that really quick in Medicare.gov. I am a little worried that we might have some hiccups because today is the very first day that we have access to a lot of the plan information for next year, and that goes nationwide. So I think about 1,000 billion, million, trillion, bajillion people
New picture.
are on it right here. Yeah, new pictures, updated graphics and everything. He's familiar.
I recognize him as well.
All right, we're gonna just find plans. And if you want a refresher on this process, again, let me know. I'm happy to schedule a time where we can go over things together. For zip code, we're just going to use the office zip code, but of course you'll use whatever you're using for the beneficiary. And we're going to keep it simple and say that someone's going from a Part D plan to a Part D plan. Do you get help with your Medicare health drug or costs? We're going to say no for this. Do we want to see costs? Why, yes, I think we do.
Question.
Yeah, I think it's really only beneficial for people that don't take any drugs and they just want to find the lowest premium. All right. Torvastatin, maybe. Somebody want to give me another drug?
Levothyroxine.
Ooh, yeah, all right. Synthroid. 128 micrograms. 125? Oh, 50. I'm way off. Okay, and then,
How about Lantus?
ooh, I like Lantus. And they'll get a 5-pack of the pen injectors. I think that's good enough for this. And of course, when you're doing this on a worksheet or with somebody next to you, you're asking them how frequently they get something refilled. So if they get it refilled on a monthly basis or every 3 months is very common, sometimes it's every 6 months. And then when they get it refilled, how many do they get? And sometimes there's a little math in here. They'll say, oh, I get it, every 90 days and I take 4 pills a day. So 4 times 90, it's 360. You'll just update that quantity and go on. That needs to be as correct as possible to get them the most accurate comparison. So we're done adding drugs here. Now we'll choose pharmacies. Of course, we want to use their preference. If they don't have a preference, then probably just the big names. And then I always try to add the mail order because a lot of times you can find the cheapest cost of mail order. And for this, we're just going to look at Kroger and Walgreens to keep it, simple. Let's see what they've got. Kind of excited to see these now, actually. Okay. Well, now that ain't so bad. So you'll go down and I'll, if they have a current plan, it's going to be the first one. And there's, last year there was a blue badge up here that said your current plan. I'm assuming there's going to be something similar for this year. But then we'll look down and we're going to try to star rating coming soon. That's interesting. This is a plan that's been available for, maybe it's just because.
It's for next year, so they've not fully written everything over
Started,
yet.
so I wonder if they just haven't uploaded the new star ratings yet.
Oh, that's a good point. Well, usually we rely on these star ratings because if someone's enrolling in a plan, we don't want to give them an option that's very, very low in star ratings because then maybe there's inaccurate drug pricing or they might unfortunately expect some poor customer service or there are a number of reasons why it might have a poor star rating.
Usually what? 4 and up?
Usually around 3. There are some that are 3.5 and 4. I haven't seen anything higher than 4.
The Part D plans have been going down in terms of the star ratings in the past few years, and we're lucky to find 3 stars. Sometimes I've had to resort to 2.5 in order to have all of their drugs covered, which is really depressing.
Yeah, at low cost. Sometimes,
Well, no, not necessarily at low cost. Sometimes I've had to resort to 2.5 just to have all their drugs covered, period.
yeah, I usually give a heads up.
Yeah,
When I-
absolutely. If
So,
you
like
give them a heads up, the 2.5 is not a great star rating.
Mutual of Omaha is one of the ones that I frequently find has a low star rating, but has a very broad formulary. So it's 2.5 stars, or at least it was in 2024. Sometimes, yeah, that was the only plan that had everything in it. So I say, hey, heads up, you're gonna pay less, but looks like this is probably your cheapest option. And then let the beneficiary decide if they want to entertain that.
There was someone I was helping at one time and we were in that situation. And I went in and looked at the star ratings. And the thing that was really dropping the star ratings was they didn't have TTY available, which is, to me, for this person,
Yeah.
that's a non-issue.
Mhm.
Yeah,
So you looked at the rest of them and it was a decent plan.
yeah. It is useful to look at the star ratings to see why it is. If it's translation services, there's something like that that's dropping it down. Or if it's, for instance, they're bad about communicating about maintenance drugs, that the person really doesn't take any maintenance drugs. Means so it may be something that's not relevant. But the ones that are really important are like people's satisfaction with the plan and people leaving the plan.
Yeah, Beth.
How do you find that? Like I know that they're saying star ratings are coming. Do you click on the star ratings and it'll give you all the reviews? Okay.
Yeah, or inside of the plan details, the section at the very bottom, you can see it expanded and you can see, for the different categories, what the aggregate score for that category is, and then for each sub score.
Okay.
Excuse me. Oh,
Jordan, if you choose mail order versus one of the drugstores.
Yep.
Who's mailing it to them?
that depends on the plan. In this area, Express Scripts is one of the, I think, premier,
Express Scripts and Optum, I think.
Optum. I think that's the other
I
one.
think.
Were there companies who specialize in that?
Yeah.
Oh, yeah.
Whoever that pharmacy plan uses as their preferred mail order vendor, and no, we don't have access to that unless you want to go out and look at the plan's website.
And do we know where it's coming from, what city or place? No.
Yep.
but it's distributed in the same way that other medications would be.
Thank you. It can be anywhere.
Yeah.
Anywhere in the country, period.
Okay, now when we're doing plan comparisons, we need documents for the enrollment process to verify our data, but we also need documents to send to beneficiaries. So this is maybe the most important page to save for beneficiary. This is what we call the plan comparison page, because look at this, we've got plans that we're comparing. So usually before I do anything else, before I start scrolling down to look at costs or anything, I go ahead and go to print and then save as a PDF this page. And I would use the beneficiary's first initial, their last name, and then plan comparison part D or PDP comparison, whatever makes sense for you to know that this is a part D comparison for this beneficiary. That's going to be uploaded to STARS later. We scroll down here, and of course, this should look familiar to most people. It's going to estimate the costs, and pretty reasonable for Atlantis in there. Well, no, I'm being silly. That's a diabetes medication that'd be capped at $35 a month. I'm thinking of Ozempic. But then the plan details, you'll want to save each one of these as well. If they're going from Part D plan to Part D plan, then one of these should have a badge that says your current plan. So you'll go into plan details. And I learned when this website is slow, you can actually save the PDF before this loads completely. So wait until you see numbers before you print this as a PDF. I jumped the gun with a beneficiary last year, and now we can't, I think it was about $15,000 saved based off retail. And we can't submit that because I was too quick on the draw. I didn't have the actual numbers on it. But if this was the old plan, where it says your current plan up here, then we'd save this as a PDF, first initial, last name, and then we'd call this the old plan details, because it's the plan that they, in the future, would have used to have. Because there's my.
Amazing the delta between retail and mail order.
Yes. And then maybe, oh, I'm sorry.
Oh, I was just going to say that that's very interesting to me that that's another change that I've seen over the years. It used to be that mail order was less expensive, and now it frequently is not. Sometimes it's, in fact, as we saw today, more expensive.
So say for whatever reason, they want to get out of Humana, which in this hypothetical, we're saying is their current plan, what they had in 2024, and they want to go to the Cigna Healthcare Saver prescription. Then we would go into this one. And if this is what they're choosing, then we would save this as a PDF once it gives us the numbers. And we would call this the new plan details. So first initial, last name, new plan details. And then we'd go on from there.
Would we also show any other plans they compared against? Yeah, show them the comparison.
Yeah, most people just want to, for a Part D plan at least, just want the cheapest option. And there's not a lot to consider between other plans. If someone's looking at Medicare Advantage plans, then I usually spend more time because there are the extra benefits and they'll want to know things like physicians and things. And for the Advantage plans, we give them that homework. We have them call their physicians, the ones that they want to keep, and ask if they're going to be in network for those plans next year.
Yeah, I was going to ask, are we doing that much enrollment in Medicare Advantage? Because, yeah, I mean,
Yeah.
I would discourage them from enrolling unless they've checked out their docs.
That's a good point. What usually happens is that we'll give them the Advantage plan comparison. Then they'll check with their doctors and then call us back to say, I've checked. They said, they'll take Blue Cross Blue Shield Garnet, and I would like that plan, please. And then we can help them enroll.
Okay.
If we are particularly busy or if someone's not comfortable with the enrollment process, what you can do instead is highlight the non-member number at the top of the plan comparison. So it works with me. This non-members number right here. And we can say, once you've gone and confirmed with your physicians that they are in network for this plan, or if it's a PPO, maybe if they're a preferred provider for this plan, then you can contact the non-member number and have the plan process that enrollment directly. Which is what we do a lot of time, I think, for the Advantage plans.
Yeah.
That's usually my
Yeah,
SOP. Yeah.
it's my go-to. It's true that some of them are not comfortable enrolling themselves and they will call back to have us enroll them. But a lot of them are perfectly fine with, once they've checked it out, calling the new member number.
Yeah, because I mean, I'm even leery of the plans websites on whether or not providers are in or out.
Be completely leery
Yeah.
of the plan, the website. Those are not a good representation of who is in the network for the plan.
They have to
You
call.
should encourage them to contact their
Mm.
current
You
position.
tell them, pick up the phone and call.
I tell them to call your provider's office, ask for insurance and billing, or maybe an office manager. What I have run into recently, and I let them know this, again, I can't change what's going on. It's getting harder and harder to get that information out of providers' offices. Several people have said to me, they've given me like an EIN number and something, and you need to go look it up. And I'm like, yeah, where do you want me to go look it up? Because, yeah, and I personally have run into it when several years ago, and I did exactly that, called the doctor, you take it? Yeah, we take it. Well, 2 weeks later, I was in there. It was a new plan that was coming out, and no, they didn't. They didn't even know they didn't take it. You have to do the best you can. You have to do the best you can. And if I've told somebody, I always tell them, do that call. And if they call me back and want to roll, and I'll verify with them, you have talked to your provider's office and you know they take this plan. If, as long as they say yes, I'll go ahead. If they haven't, we'll have more of a discussion.
So that's the standard process for doing a plan comparison. If you want to practice, again, we do have practice worksheets available. Just let me know and I'm happy to send those your way. And then I'll do them myself when we can compare notes and maybe get on a Teams call and argue with each other in a good natured sort of way.
Jordan, just one clarification. I think you said, I'm just clarifying, because I think I'm doing something different. You're using the three comparison of 3 on the PDP as the old plan details?
Oh, no, that would be the Part D plan comparison or PDP comparison. Then whichever plan they had in 2024, we would add to that, but then save that PDF as the old plan.
But you mean the actual plan details from that old?
Yeah.
From
Okay,
the old plan.
I thought I heard something different there.
I may have misspoke, so thanks for clarifying.
Yeah, I think the confusion comes in because for the comparison, you have to have the 3 plans and that needs to be saved. But the reason why you're saving that to STARS is not because it needs to be saved for our proving it. You're saving that to STARS because you're going to be sending it out and maybe they're going to be calling back. I mean, you experience that all the time, right? I'm sure.
Yeah.
So what you're saving that needs to be there to prove it are exactly what's up there and that Jordan described, that you need to have the old plan details, the new plan details, and the you're all set confirmation. Those are the 3 things that you need to have to
A
prove it.
little clarification that they're keeping the same plan. Do we not need then in STARS to fill in the delta in cost?
Sure, if they're keeping the same plan, then SHIP has not done an enrollment. They'll have automatically enrolled. And
Right,
if SHIP does not process the enrollment, we don't take any cost comparison measures. We still save the Part D comparison, the 3 side by side. We still save the 3 plan details just for general note keeping. But as far as the old price versus the new price, because we did not process an enrollment, we do not capture that.
so on most Medicare Advantage, we're not able to track because they're enrolling themselves.
Oh, yeah, the ones that they enroll themselves, we don't track. The ones that we process, we do. Yeah. Yes, but
If they're staying in the same plan, we don't save the all set page, we just save previous
yeah,
and the plan.
if they're staying,
Be an all set page.
exactly so.
Right, so we don't have to do anything, we just tell them that you're already enrolled.
Yeah, they'll be automatically re-enrolled.
Okay,
We still have to do things like our getting all tongue tied. Our note taking.
Okay.
So the side-by-side comparison, we still need to save that as a PDF to put it in STARS
Okay.
along with the 3 plan details. But then we don't have to really do anything beyond that. Except for, of course, sending the information to the beneficiary if they want that.
Yep.
Yep.
So you want all the plan details on all 3 plans that you're sending to them saved. I'll be honest, I haven't been doing that.
No, you only have to do their old plan and the one that they're enrolling.
For the enrollment confirmation stuff.
Right,
Yeah.
right, when you're enrolling them.
Yep.
But when you send them out, you send them the full thing of everything.
Not usually.
Yeah, I talk to them and ask them, and you want me to just send the first one? If they want another one, then I'll send it to them. I just want.
So with Part D, ordinarily the comparison is sufficient.
Yeah, right.
With, just as Jordan said, with a Medicare Advantage plan, they may want to have the details on them. When I'm emailing it, frankly, I often send out the details of the plans just because they're right there. But most of the people on the Part D are, when you're talking to them, they'll tell you what they need.
Well, I always send out the details to the beneficiary on the plan that they think they might choose.
Right.
Because we always have this conversation about, especially if they're on a lot of prescriptions, they might find one or more of the pharmacies beneficial to them.
Yep.
And it doesn't mean they have to purchase everything from one pharmacy. So I always send that page out every time.
Okay. Any more questions on that? All right, we're going to enter now a technical discussion if you're processing enrollments. If you are a new volunteer and you're interested in processing enrollments, it would be good to pay attention, but it would not be good to worry. It might get a little confusing, and that's okay, as long as we are saving the documents that we've just described. So the plan details of their old plan, the plan details of their new plan, and the enrollment confirmation. All of the math we're going to talk about is something that we can do later together. So don't feel any sort of pressure about having to get everything perfect by yourself. I'm happy to run through everything with you. Actually, first, I think it's the naming conventions. So our state partners at the Department of Disability and Aging, they have begun to take it upon themselves to do all of our review for our cost-saving measures. And because they are doing it themselves, they've asked for a particular naming convention for all of the PDFs we send to STARS that prove we've saved people money. Or, well, yeah, we'll leave it at that. So DDA has asked for this naming convention. If someone's new to Medicare, so they have never had Part D drug coverage or Advantage plan that included drug coverage, we would call them new to Medicare. The enrollment confirmation, we would put first initial, last name. Don't bother with the underscores if you don't want to. As long as it makes sense, it's all right. But they want first initial, last name, initialism NTM for new to Medicare, and then call that the enrollment confirmation. The plan details, because this is the first plan they've ever signed up for, it's their new plan. First initial, last name, new plan details. More likely, you're going to encounter someone that already has drug coverage and they're changing plans. If that's the case, then we want first initial, last name, and an enrollment confirmation. Notice that NTM has been dropped from that because they're no longer new to Medicare. Then the plan details for the new plan is first initial, last name, new plan details, and then the old plan is first initial, last name, old plan details. It's pretty straightforward. As long as you're naming the document something that makes sense, they should be okay. But this is the naming convention they've asked us to share with the
As a
volunteers.
Data person,
Uh-huh.
I would say put the underscores in there.
So to avoid the
So-
%20.
Yes.
Yeah.
So it's a bit of a, yeah, because if you put a space, it'll, yeah, and depending on where it's being stored, it has to have something in there. So put that %20.
STARS usually doesn't have an issue with it,
Okay.
but that's a big usually.
Yes, sir. Exactly.
Yeah.
Exactly. It always takes one programmer who's not paying attention,
Mhm.
looking for the underscore.
Okay.
So, I did have a question on that. So
Oh, yeah.
on the new plan details, that would be the one that the beneficiary has said, yes, I think that's the one I want. Or is it all of the?
Yeah, it's the new plan details is when we have done the enrollment for somebody.
Okay,
And it's the plan into which we have processed the
Okay,
enrollment.
okay.
That's good.
make sure.
So back to cost saving. There are three general situations that we're going to encounter when we are enrolling someone into a new plan. When we do that, there are a few things that we have to do in STARS. One of them is selecting an either Part D plan or, Part D drug coverage, or in Medicare Advantage, those topic boxes, there's an enrollment button. We'll select that when we process the enrollment. If they're new to Medicare, then in the additional topic box in STARS, we'll select new to Medicare. But down in the later sections where it says special use fields, the first two are original price and new price. And we enter our cost saving data there. When someone has a Medicare plan and they're switching into a new plan, then we're going to look at the old plan details for the original price. We're going to find whichever plan they're using. We'll open up those details. We're going to find which pharmacy they typically use, because we need to note which preferred pharmacy in the note section of STARS. But we want the total drug and premium costs. So everything that they would pay under that plan if they had kept it for 2025. And we put that in the original price special use field. It's the very first one. Then we go to the new plan details. We look at the pharmacy they're going to use for 2025. We find the total drug and premium costs for the plan in 2025. And we put that in the new plan details. And then down in the notes, we note the pharmacy and if there's a change in pharmacy. All of this is information that not just our state partners, but our federal partners, ACL, the Administration for Community Living, who gives us funding for which we're eternally grateful for, they want that information, I think mainly to take to Congress to say, look how great everyone is, and please continue to give us money so we can continue to give people support. Now, if someone is new to Medicare, then we're going to look just in the new plan details, and we're going to find the retail cost of the medications, which is further down here. They're going to say yearly drug costs by pharmacy. If there's one that's out of network, it'll give retail cost for everything. So you can just use the total yearly drug cost. But a lot of times you'll find that all of the pharmacies are in network. So we have to do a little bit of math. What we can do is come down here, and if they only get monthly refills, then what we can do is just get the estimated drug costs at the farm. Oh, sorry, I got ahead of myself. We'll look at Walgreens, which was covered. Disregard what it said, because that's making an assumption that this is the retail cost, which it happened to be for this one, which is why I used it, but might not always be. So I've given you bad advice. Please ignore me, but pay attention to me now. So what we'll do if they have only monthly fills is to find this monthly total and to figure out how many months they're going to pay that. For most people that are not meeting their out-of-pocket maximum, it's probably going to be 12. And so we'd multiply the monthly total by 12, the number of months that they'll pay that. And that would give us the retail cost of the medications. And that might change from one pharmacy to the other. So it's important to use the pharmacy that they are going to use. And it's important to note that in STARS. But we want the full retail cost of the medication. So if they have a mix of monthly and quarterly medications, then it gets a little confusing. So say maybe they take levothyroxine, but they get it filled quarterly, at that point, oh, but atorvastatin and Lantus are filled monthly. At that point, this monthly total is no longer going to work for us because this is assuming that they're getting levothyroxine, 12 times, not just 4 times. So we can't use that super easy math. So you want to keep a note of which medications they're getting refilled, how frequently. Now, most people will get either completely monthly fills or completely quarterly fills. It's less common that we have a mix of monthly and quarterly. Ray, Nancy, is that about what you guys see? It's usually one or the other. It's not a typical blend.
But there are some which are all over the place.
That's true.
Really.
Yeah, if you have somebody that has 8 or 10 or 12
I had one that had
prescriptions,
21.
they're gonna have a mixture almost
Yeah.
every time.
Yeah.
I was about to say, the more medications they have, the more likely it is to be a mix.
If that's the case and you're not comfortable figuring out the refills and the costs per the entire year, that's all right. Save the documentation, let me know about it, and we can walk through it together. When I was still doing our cost comparison data, which I did not do for the last 6 months, I just used, no, wrong one, a little thing like this. So I would just type in the price and the refills, and then I would make Excel do all of the information for me, or all the math for me. All I had to do was make sure I didn't have a typo. If you guys want this, I can send it to the ShipFall account, or I can send it to whatever. This is not a very pretty calculator, but I can send it. Okay.
Yeah.
All right, sure. I'll send it out to everyone. Maybe I'll make it prettier first, and then send it out.
Ugly works.
Ugly works?
Yeah.
Well, thank you. I would- Yeah.
It can be ugly.
I want to emphasize something that Jordan basically already said, but I want to specifically say that you'll note that you have to expand the preferred pharmacy in order to see those numbers. So when you're saving that PDF, do make sure that you're saving it after you've expanded the preferred pharmacy. So don't save it first thing when it first opens and the numbers fill in. You are going to first need to expand the preferred pharmacy and then save it.
We might test that. I've noticed recently when I save as a PDF, it expands all of the pharmacies.
Oh, well, cool.
So I don't have to go down and expand
Yay.
anything.
Because I have in the past had difficulties, but I'm really glad. Yay.
In fact, actually, I did a plan comparison yesterday afternoon. Let me just look at that briefly on my own machine. So sorry, no one gets the benefit of seeing it. You'll have to trust me for my word.
We totally trust you, Jordan.
Well, that's a mistake. Yes, it looks like it's expanded all of those. So as long as the numbers up at the top have filled in, because it does take some time to load, so wait for these numbers to fill in, then we should have the information in the entire document and you can just save it as a PDF. Okay.
Question.
Yep.
If you've got somebody on a Medigap plan.
Yep.
And they move to a Medicare Advantage plan.
Yep.
There's a lot more calculation and benefits at that point.
They only look at what they will pay for their drugs.
That's it. Okay.
That's it.
So you just look at their Part D and compare.
Only the Part D portion of the Advantage plan.
Okay. so
That's a good thing. We don't care about
Part D
other
against
copays.
the Advantage plan. Got it.
Uh-huh.
Yeah.
And so in that case, when you're doing the comparison, I wonder if I can just back up and get back to it. What you may have to do, say, if they're going from Part D to an Advantage plan, is select their Part D plan and find the plan details for that and then save it. And then they say, I do really want to look at Advantage plans and not Part D plans. We'll have saved the Part D plan first, probably under old plan details.
Yep.
And then we wait for it to load. And we wait. And then we can select plan type here and go to the Advantage plan.
Okay.
And then we can do a side-by-side comparison of 3 Advantage plans, which none of them would be their old plan details.
Yeah.
So do keep that in mind if you're switching from one route to another route. If you're going Advantage plan to Part D or Part D to Advantage, You might not be able to do the side-by-side comparison using the old route with the new
Right.
route.
One of the questions, if I'm not getting ahead, is you're on, you got a Medicare Advantage plan, persons on the Garnet plan, and no more Vanderbilt next year.
Yep.
They say, the heck with it, I want to go back to original Medicare
Yep.
and a Medigap plan,
Uh-huh.
but now they're going to get underwritten.
You are, in fact, getting ahead of us. We have a dedicated time to discuss that exact scenario later on. Okay. Back to the PowerPoint, back to cost savings. We talked about getting the original price based off of the total retail cost for the drugs. We then follow the same thing and under the new plan details, look at the pharmacy they're going to use and get just the total drug and premium costs. So everything that they will pay for their plan with the new plan, and then put that into the second special use field in stars. So it follows the same. The third is something that is a thorn in our side, honestly, and it's a little tricky, and feel free to not worry too much about it. Sometimes we'll have somebody whose birthday is in October or November or December, and happy birthday to all of those. But they're going to be new to Medicare and maybe also finding a plan for 2025. So if their birthday is this month, they might be enrolling in a plan for this month. Rather, if their birthday is next month, if their birthday is this month, we hope that they've already enrolled in a plan. So I guess forget happy birthday to October kids and just November and December. So they might be joining a plan for November, which will cover them for November and December, but that same plan might be out of area or not work as well for 2025. So they'll look for another plan for 2025. And it might be that we enroll them in both plans in the same counseling session, which becomes a little tedious when it comes with the math. It's tricky, but essentially you're just following both procedures. So new to Medicare and switching from one plan to the other. You're adding the original prices from both procedures together, and you're adding the new prices from both procedure together. In stars, we're saving the plan comparison, the enrollment confirmation for the plan 2024, the enrollment confirmation for plan 2025, the new plan details for the 2024 plan, and the new plan details for 2025 plan. That's 5 documents, which is great because that's all that stars can hold. We can just get around that. If it works for the beneficiary, if it works for you, you can process the enrollment for the 2024 plan in one day, and then on a subsequent day, process the enrollment for the 2025 plan and not have to worry about the headache of multiple maths. Sometimes though, a beneficiary is not available later, or maybe you're about to go to, was it Tripoli you said earlier? Maybe you're about to fly to Tripoli or boat if you want. They have shores, don't they? They must. If that's the case and you must do it that day, don't be afraid about the tricky math because again, as long as you're saving all of the plan details and we know which pharmacies they're going to use, and you've got the enrollment confirmations, then we can work together to do the math to make sure that everything looks okay.
Real life.
So we can't have 2 stars entries on the same day for the same person.
ACL says same day, same person is supposed to be 1 stars entry. If we do same day, same person, what happens when we do the cost or the price saving thing is that we're supposed to merge those together into one contact form, which is kind of a headache. But since the state's doing it and it's not my headache, I don't know. But
I think the state has some opportunity here.
Then like bring it back to you, you know?
just in case, which they have done in the past. If that's the case, it would be best to do 1 stars entry, but we don't have to do the stars entry that day. If you save all of the documentation, let me know that day that we need to do that stars entry. And then as soon as we can, we'll meet probably over Teams and we can do that entry together to make it clear for the state. That way, they don't have any headaches and they don't send it to me for a headache. Thanks. Nancy.
A situation, again, right, they're just going on Medicare now, so they're looking at both years.
Yeah.
This is live several years ago. The one found the plan she wanted for that year. I don't know what company it was. For the next year, there was a different plan, but with the same company
Okay,
that looked to be good. So we enrolled her.
Sure.
Both.
sure.
Don't do that. Because when it hit the plan, they were just putting her in the plan for the next year. And she had to go back to them and said, no, I want this for this year and I want that for next year. It can, again, when it hit whatever plan she was rolling in, it was a nightmare. So I totally agree with everything you said. Use caution because and again, if you're now sitting at Blue Cross and these two both come in at the same time, are you taking the time to look at it, to look at one is for this year and one is for next year? And that's where it fell apart. She finally got it straightened out, but it was a big headache.
So you think that the company got these applications and just
They
confused the years or
they did the one for the next year. Oh, we don't need that. We've got to do one for next year. So that's what I'd say. Enroll them for this year. Do that today.
And just,
Then wait. You've got till December 7th. Don't wait till December 7th. And again, it says the plan has 10 days to process. So
Okay.
I'm even thinking, let that 10 days go by and then do the second one, because now they've got her in the system already and she's changing her plan for next year. But when both of those hit that plan at the same time, it blew up the system or something. It was a nightmare.
Jordan,
Yeah.
I have a couple of questions.
Leanne, I hope I have a couple answers.
Oh, good. Okay, so I'll kind of go backwards here. So from that last slide, when in that scenario where someone is just signing up and they're also signing up for next year, when you pull up in Medicare plan comparison, when you're signing someone up, it only gives you the cost from there forward to the end of the year. So if you compare that partial year, we'll say it's 2 months, to the cost for next year, which would be 12 months because they're looking at the full year. That
Right.
obviously doesn't seem to be an apples to apples comparison. What am I missing?
Sure. So we are adding the original new costs together for the 2025 and 2024 comparison. So the original cost for 2024 would be the last 2 months of the plan year. Retail price compared to the last 2 months covered by whichever plan. Now, moving into 2025, the 2024 plan is considered the old plan. So you would look at the plan details for the current plan if they keep it into 2025. So 12 months under the plan that they're enrolling in 2024, and then 12 months for the 2025 plan in 2025.
Okay, retail cost versus.
Do match, yeah.
Okay, got that.
Yep.
And then the other question is from the previous slide, and just a technicality here. So when you are entering that one. So when you are attaching the document, we'll say under number 1 for the old plan, and the new plan, then you note if there is a change in pharmacy. Does that go into the third field, or where does that note if there's a change in pharmacy go?
Right. So we should be changing or noting not just if there's a change in pharmacy, but always note which pharmacy we're looking at for the plans.
Right.
That goes into the notes field in stars. So the box at the very bottom. That's a great question.
Okay.
Thank you.
Okay, so that goes into the notes and the attachments go into let's see, that's right.
Yes.
There is a place for attachments and then there's a place for field. Okay, all right.
So we're entering in the dollar amounts. And I should say here, I forgot to mention, and they'll be upset at me. There are some instances where we've been told that we can round to the nearest dollar. DDA, our state partners, have asked us to never, ever do that. They want the full dollars and full cents for all of the costs. So even though ACL says that they're okay with rounding, DDA, who actually gives us the funding, has asked us to not round. So I bring that up because we use those costs and we type those costs, full dollar, full cents amount, in the special use fields 1 and 2. We put the pharmacy notes in the notes section, and then we attach all of the documents where we attach documents in stars. And if that has confused anybody, I wouldn't blame you because it's super tricky. But if you don't know stars enough to bring it up in your head when I'm mentioning this, that's okay. We can meet and we can go over stars before you'll ever have to actually use it. All right?
Thank you.
Thanks. Of course. Did anybody else have any questions that's going virtually? Tom or Steve or June? If not, Julia's got her hand up. Oh, Tom.
Just again, a quick clarification. They're keeping the same plan.
Uh-huh.
Well, they're new to Medicare.
Uh-huh.
They've got Plan A this year, but they're going to switch to Plan B for next year.
Okay.
We handle the cost differential for that.
We do.
Okay. They've got Plan A this year. They're going to stay on Plan A next year.
Uh-huh.
We don't worry about the cost differential.
Nah, because we aren't processing an enrollment. We would worry about the cost differential for the 2024 year, the last few months,
Yeah.
right? Which probably isn't going to be a huge amount, but any penny looks good for us. But because we're not processing the enrollment for them to keep Plan A into 2025, then our hands are clean. We don't have to worry about that at all. That's a good situation. Thanks.
Good.
And if they are keeping a plan, should you probably put in the notes, we'll keep the plan they have?
I usually do, just in case they call back and say, why didn't you change my plan? We can say, well, it looks like you were interested in sticking with the current one. It's not on us.
Yeah, anything you
But
want to
then they got
remember,
next year
like,
to do it again, so January 1st
Well, if they're
for Medicare Advantage.
in an Advantage plan, so people in original Medicare are locked out of that.
Yeah.
So,
I was just going to say that you want to put anything that you need to remember or that you need us to notice in that notes box. So I always put new to Medicare in there, even though you've checked new to Medicare, putting it in there, then if by some unforeseen circumstances you checked something instead of new to Medicare, then we can look in the box and we can see that it's new to Medicare.
and Julia.
So once they open enrollment for 2025 and you go to plan compare, I assume, is there going to be like a option to look at 2024 or 2025?
Yes, exactly. So, and in fact, that option is already live
Okay.
and I skipped it completely.
Because I was asking, because I assume for those folks who are, the November, December birthdays, so for 2024, we would do new to Medicare enrollment confirmation. We would do the 2024 new plan details. But then when we do 2025, I'm assuming we'd also want to pull that old plan for 2025, is what you're saying?
That
Because
is
the cost will
exactly
change. Okay.
Yep.
Okay. Got it.
Which,
So here you would go to both. You do one and then you do
Yes.
the other.
Yeah, so we'd
Yeah.
be saving their old plan twice. We'd do the 2024 version of it and then the 2025 version of it.
that's
But you're
exactly right.
creating the 2024.
Okay. Got it.
So this is where, and I'll let you know, I went to Medicare.gov, health and drug plans, find health and drug plans. This is the screen. They didn't update this guy, which is good because I like this guy. I've actually seen this.
Great mustache.
He does.
I was actually thinking that too. I was like, man, that's a.
And then you choose which plan you're looking for. So that's a great thing to bring up. I kind of flew by that because I'm used to it. But this is the first AEP for many of you. I shouldn't have. Thank you for bringing that up. Okay. I think that's all we need to talk about for enrollment process and saving documentations and entering figures. If you have questions or if you want practice, let me know. Again, I've got 2 weeks where you guys are my priority. So anything that you need, please let us know so we can get a training set up and we can get you up to speed on things.
Oh, one quick question. Sorry about that. They are not already enrolled in Part B. They're new to Medicare, new to everything.
Okay?
We can help them enroll in Part B?
Never. We have to send them to Social Security and have them process the enrollment.
And then have them come back to us.
That's right.
Okay.
We could still do, if they really want, a Medicare Advantage plan enrollment, plan comparison. But I tend to hold off on that because if we're doing a comparison, say in October, it's going to show us the cost for November, but they might just be going to Social Security today. And Social Security might not be able to start their Medicare until December because it takes They say about 6 weeks to process that.
Yeah.
So I say hold off, and then once you get your new card, call us back and we can help you do a plan comparison.
But they can get their Part D. If they've got their A already and don't have their B, they
That's
can go
true.
ahead and get their D. So you can, if they're thinking that they're going to stay with original Medicare and they no longer have drug coverage, it's good for them to go ahead and get their D.
I'm sorry, it's good for them to what?
If they think that they're going to stay with original Medicare
Yeah.
and their drug coverage from their employer, for instance, has ended, then it's a good thing for them to go ahead and get their Part D. So you can enroll them in their Part D, because with Part,
Even if they're not enrolled in Part B, you can still enroll them in Part D.
that's correct.
True.
Right.
Now, there is a likelihood that they're going to have a late enrollment penalty. Medicare.gov usually flags that, but we have to send them to Social Security to figure out exactly what that penalty is going to be.
If you go in through someone's account, they already have a username and password. I'm looking it up because it's, again, the 2020, you missed,
Yeah.
yeah. But, so I went in, I told it what year I wanted to look, and then I've changed it. And now at the top of the screen, it tells me you're viewing 2024 plans, show me 2025 plans. That's when you go in through somebody's account. Initially, you will tell it what year you want. But then once you get in there, you will have an option of going back and forth between the 2 years.
Okay. Well, it's 10:20 now. I think now is a good time for a break. We'll start back up 10:30 sharp. We've got a lot more to cover and an ever decreasing amount of time.
Okay.
What we're gonna do now is briefly, oh, come on, mouse. Go over Plan Finder changes. I had thought we would go through together and explore Plan Finder. I think we're running out of time. We've gone over by a decent amount, which is okay. What we've talked about is important. But I want to finish content before we go through and look at. Oh, that's true. That's true. So we might have time at the very end to go over some Plan Finder changes, but a few reminders about plan comparisons and enrollment. When you're in doubt with a medication, ask the beneficiary. Try not to make guesses on your own account because we don't want to be responsible for giving someone incorrect information. We want to make sure that everything we give is as accurate as possible. When in doubt about enrollment outcomes, so those are the numbers that we were talking about, just save all of the documentation and you can work with me to find those price numbers. It really isn't difficult once you've done it a few times. It's just more of the procedure is a little tricky. Don't round numbers. They want the full dollar and cent size, and try your best to follow those naming conventions, and you've got the notes on those in the PowerPoint. If someone is new to Medicare, be sure to check that in stars under the additional topic box. If you don't know immediately off the top of your head where that is, let me know and we can do another stars training together. You do also have to check enrollment, but that's something that most people remember to do. If a plan is leaving the area, so if someone is in a current plan and it's not going to be offered in the area in 2025, ACL says treat that as a new to Medicare enrollment. So we would not have old plan details. We would only have new plan details. And for the original price, we use the retail price. Remember, oh, I maybe did have it. Remember to check. Oh, you added that?
Yeah.
I was just thinking last night that I had forgotten to. And then as we started this, I thought, oh no, I never changed. So thank you so much for Christine. Remember to check the appropriate enrollment box. So if you enroll in a Part D plan, that's going to be in that box. It says enrollment as an outcome, or Medicare Advantage, same thing. And a big one, a huge one, an absolute, can't forget this. Never enroll someone in a dual special needs plan. There are layers and layers of regulations about dual special needs plans. As a reminder, these are those Medicare Advantage plans that are meant for somebody that has both Medicare and a type of Medicaid, so either QMB or TennCare Medicaid. We cannot process those enrollments. So we can do the plan comparison, but we have to send the beneficiary to the plan itself for them to enroll. We can't do that because we'd be circumventing very important rules. All right, so Plan Finder changes. we'll talk about it here in a moment, but the Medicare payment plan is new this year. It should be on there when you do a 2025 comparison. And from what I understand, it should highlight when Plan Finder thinks that it makes sense for a beneficiary. We'll talk about the payment plan here in a bit. We were told, I've not seen it yet because we've not processed any enrollments yet, that counselors are now going to be required to enter our names when enrolling people into a plan. So if a broker or an agent enrolls someone into a plan, they've got to add their name and include their identification number. We don't know yet what it looks like for a SHIP counselor. So this might be a hiccup that we see right at October 15th, but as soon as we know what it's going to look like, we'll send out an email to make sure that everyone understands what's going on. If you aren't comfortable attaching your name to an enrollment, that's okay. You can send the beneficiary to the non-member number at the top of the plan details, or send them on to Christine or I or one of the other counselors. Drugs are more easily identified when they are not covered. There's now a badge near the top of the page when it says it's not covered. It's a yellow badge. I should have, for the comparison earlier, found one that wasn't. But it says very easily, very clearly that it's not covered, so you know why maybe estimated costs might be above $2,000. It's because there's an uncovered drug. The location-based pharmacy search should now be possible, so you can click Use My Location, and it'll show you the pharmacies around your physical location if you've got locations turned on your laptop. But for most people, they just use their zip code, and that's been easy to use. And if you have the drugs already loaded into the plan, if someone has an account, then the pharmacy search screen might actually show your estimated costs based on your current plan. But I haven't seen that yet because we haven't gotten there yet. We were gonna plan some time to poke around, find out what all those changes looked like, but we've got more content to cover. So maybe if we get a free time later, I might record something and send that out. But maybe we have a chance to do that at the end of this, once we get through content. All right, so Medicare payment plan. That's something new this year. We expect that we're going to have a lot of questions about it. It is a way for people to smooth out their drug costs. So new maximum out-of-pocket costs for covered medications, remember, important to say covered medications, is $2,000. It could be that someone is on really expensive medications and the $2,000 all comes in the first half of the year. And for people that are on limited income but don't qualify for extra help, that might really be difficult for them to cover. So Medicare is now going to allow a payment plan. It does not take the $2,000 and spread it out exactly evenly over the entire 12-month period. It does not do that, but it does smooth payments out to make it maybe more manageable for a beneficiary. Only covered drugs, so only drugs that are going through the Part D or the Advantage plan are eligible to be covered by the payment plan. The beneficiary has to contact the plan in advance of getting medications through the pharmacy to have it go through the payment plan instead of the pharmacy. The pharmacy cannot initialize an enrollment in the payment plan. So you have to go to the plan provider to start the payment plan. It's, in general, best for people who reach their maximum out-of-pocket costs early in the year. Medicare says end of September at the latest. I think mathematically it's better for the end of August, but we're kind of splitting hairs at that point. It's probably not beneficial for people that have consistent, manageable costs each month because the payment depends on when the copays are incurred. It's probably not beneficial for people that don't hit their maximum out-of-pocket unless they have a very particular financial circumstance. Again, if Plan Finder thinks a person might benefit, then there should be something that highlights on Plan Finder. We haven't seen that yet. Actually, Nancy, maybe you saw that in a training earlier last week, but we hope to.
The national training program, and I actually, because I had missed the first 45 minutes, but it's not posted yet to the training website.
Sometimes they take a couple of weeks to put
Yeah,
their reports on there.
But yeah, it showed, and I actually looked in my account earlier, and the message was there in
Okay.
the drug session, but it wasn't highlighted.
Okay.
What they showed there was there'll be like a blue bar come up at the top, and I don't know if it's the eagle, some sort of a icon on the
Oh,
left-hand
CMS.
side, and yeah, that this may be good. to highlight it, to bring your attention to it, that this may work for this person.
Okay.
Jordan? George.
Yes. Is that
Tom
Tom?
Wynn? Yes.
Okay.
One of the questions that I posed up at the meeting was, are all pharmacies required
Yeah.
to recognize the payment plan? And they were going to look into that. Have you heard anything?
No, I think her name was Lisa Sessions from the Atlanta office.
Yeah,
She-
my guess is going to be they're not required. So we
Well,
may have, I don't know.
one of our volunteers is actually involved in the retail pharmacy at Vanderbilt. And we were talking about this from the pharmacy side of the ACL trainings, or I'm sorry, of the CMS trainings. They've been told that all pharmacies must recognize it, but I am not sure that that's 100% correct because they may have just been talking to Vanderbilt specifically when they said that. And I think Vanderbilt is a large enough pharmacy network that they would be required. So
Right.
Lisa has a number of questions that she said she'd get to us within the next 2 weeks, which gets it to us, I guess, a week before annual enrollment actually starts.
No, it gets, it gets it to
But
us as it starts.
As it starts. So I guess long answer, made short, no, we don't know yet. Now, for people that are involved in the payment plan, one of the recommendations we were given at the conference is that if they are mailing in their payments for the premium for the plan, so to have the plan at all, they should be mailing in a second separate check, so maybe one envelope, but 2 checks, to make it clear that one check is for the premium and one check is for the payment plan balance. And this is in case they fall behind on the payment plan balance. It's very clear that they're continuing to pay their premium, so they're not disenrolled from the plan. There are some cases that may happen that we won't talk about now because we don't have too much time. But if somebody doesn't pay the payment plan payments, then they can be dropped from the payment plan. But as long as they continue to pay their premium, they cannot be dropped from their Part D plan. At least that's our current understanding.
Yeah, so we went really into the weeds in this on Thursday, and I feel like there's absolutely no need for us to go into the weeds on this. If the beneficiary you are working with has questions about the payment plan, they should be talking to the plan. The plans are running these. I really feel that the plans probably have the answers to most questions about the plans. And that's who they should be talking to, not to us. So just say, I would even go so far as to say, if they have a lot of questions about the payment plan, you might suggest that they enroll themselves, that they call it that non-member plan and get the answers to their questions before they enroll.
I'm not going to spend a lot of time on this at all, but just to emphasize something. The payment plan that people sign up for, and this makes the assumption that they sign up for the payment plan in January, because people might hear there's a new payment plan and it's going to help people out. They might say, oh, I'm really excited. I want that. But it really can become a trap for some people. So in the situation, and this is one of the situations that Medicare gave us, you can find this on medicare.gov, is if they have consistent payments throughout the entire year, look what happens to the payment plan. Because the way the math works out, by the time they hit September, they're going to be paying more in the payment plan than they would if they just paid the co-pays. So if they've got relatively even, pretty well spread out things, they might say, I want the payment plan because it's a flashy topic. I think referring them to their payment provider, the Plan D provider, to get the specifics on that, or checking if Medicare.gov recommends it is a good idea before we say, yeah, it looks like it might be beneficial to you, because somebody might get trapped later on at the end of next year, paying a lot of extra money at a time. Look at this. This is the holidays. This is when people need money the most. So I've got this. I can send this out too if you want. But the payment plan option in Medicare.gov is what I think people should be looking at if it highlights. But if they have any questions at all, Christine's 100% correct. Send them to the provider itself. Send them to that pharmacy. I'm sorry. Send them to that plan. Thank you. So many words that start with P with this. Okay, so plan changes and guaranteed issue. Now, we have a number of Medicare Advantage plans that are leaving the area. This means they're not offered starting January 1st. And there was talk about people having what they call a guaranteed issue right, which everyone should know as a period of time when someone can enroll in a Medicare supplement insurance policy without going through medical underwriting. So if someone in 2024 has a plan that will not be offered in 2025, I've called Medicare. They've told me that they do have a guaranteed issue right starting November 1st. So 60 days before the plan leaves and up to 63 days after the plan leaves, they can get some Medigap plans without underwriting. So people that have been on a Medicare Advantage plan for some time who are now interested to move back to original Medicare or maybe to original Medicare for the first time, they do have this flexibility. The plans that are available are listed there. Medicare, they weren't really able to give me an exact process that they thought would work best. What we think might work best for these people is to first do the Medigap comparison. So whichever Medigap they're looking at, that's probably going to be G. For most people, that's the most common. N's the second most common, I think, in this area, but that is not one of the ones that they're able to get according to Medicare.gov through the special guaranteed issue right. So do the comparison for the drug plan, do the comparison for the Medigap, but have the beneficiary reach out to the Medigap company first, confirm that guaranteed issue right, confirm that they can start that January 1, and then help them enroll in the Part D plan. There's maybe some concern that if someone enrolls in a Part D plan, so moves from the Advantage plan into original Medicare before they confirm with the Medigap, there's some concern that a company might see this as a voluntary move to original Medicare in the usual way, which does not give them a guaranteed issue right. So we want to make it clear to the Medigap companies that they should have that guaranteed issue. So real quick, Medigap first, and then come back to us for the enrollment in the Part D plan. Now, we talk about this because Farm Bureau is leaving the area completely. So Part D plans, they're gone. All of the Advantage plans, they're gone too. So people that have a Farm Bureau Advantage plan this year should be eligible for a guaranteed issue right and could go back to original Medicare relatively smoothly next year. That is because the plan is no longer being offered in the area. A second major change is that Blue Cross Blue Shield is no longer going to be accepted at Vanderbilt. Now, it's still in the area. You can still get a Blue Cross Advantage plan in the area, which means that you do not have a guaranteed issue right. To earn that guaranteed issue right, or rather to be eligible, earn is not a correct word, to be eligible for that new guaranteed issue right, the plan itself must be leaving. A change in providers does not give that to you. I think we've already had two calls about this. Maybe a dozen calls about the Vanderbilts, but 2 calls specifically saying that Vanderbilt's leaving. Do they get a Medigap now? That is not the case as far as we understand it. The plan itself must be leaving to get that guaranteed issue.
Question.
Yep.
If you've got a carrier who has 3 or 4 different types of Advantage plans, and they eliminate one of the Advantage plans, does that generate a GIR?
I asked that question to the lady I spoke to with Medicare yesterday. She said if the plan is no longer sold. She did not say if the carrier is no longer in the area.
Gotcha. So if Farm Bureau were still leaving a plan, but all the other ones were gone, you'd still get GIR for the plans that they discontinued.
That's what I think her name was Brittany at Medicare said yesterday, but that gets a real tricky situation. What I suggest there is saying to the beneficiary, it could mean that you get a guaranteed issue right, and then send them to the Medigap company to confirm. Because the Medigap companies will absolutely know.
Right.
So.
Oh yeah, they're standing in line.
Yeah. Anything to add there, Christine?
No, that's
Okay. And the last thing, there's a new provider in the area called Zing. I thought that was kind of a goofy name, so I wanted to point that out. Apparently, it's a legitimate company. It's brand new for 2025. I've got no idea about it at all, but Zing is real.
Zing is Advantage
Yeah,
or
I think-
supplemental
Yeah,
Oh,
Advantage.
Advantage is what I saw.
they're advantaged. We contract with them in a few other states.
Oh, yeah?
They're fun.
Okay, cool.
Thank you.
Yeah, they're real.
They exist.
Yeah, they're in Illinois, Indiana, and I think Michigan. So I think they're coming back down. Yeah.
Okay.
yeah. Assuming that somebody, back to my original question, wanted to leave a Advantage plan and into a gap plan.
Uh-huh.
Do we help them with the underwriting issue?
No, we do the comparison for them. We give them a list of companies that sell the plan they're interested in. Then we refer them to those companies to talk about medical underwriting.
Gotcha.
We explain that medical underwriting probably will exist, but because we aren't those companies and because each company has the ability to make its own rules, we send them to that company to get those rules. Fewer middlemen, less chance of issues or errors.
Yeah, yeah.
Do we see a lot of anticipated changing, shifting back because some of these companies are,
We've never had this happen before to this degree. So it's
Chart new waters.
uncharted waters for us.
Okay. So special enrollment periods, we're going to bring it up because people ask, but we're really going to talk about this in our December update training because we're a little less sure about one thing. Currently, if someone has the low income subsidy, then they have a once per quarter chance to change how they get their drug coverage. This is actually, it's October.
Yeah, it's
They can no
October.
longer use it.
Yeah, it's done.
It's October 1st. So they did have an ability to change plans once per quarter. No longer do they. Starting next January and through next September, if someone has extra help, they do get monthly flexibility instead of quarterly flexibility to change their provider. However, that flexibility only goes into original Medicare. So if they have a standalone Part D plan, they can move to another standalone Part D plan. If they have an Advantage plan, they can go back to original Medicare and get a Part D plan. They cannot go from a Medicare Advantage plan to another Medicare Advantage plan, nor can they go from original Medicare to an Advantage plan like they could have in the past. So we will talk more about that in December. They make it just as clear and straightforward as possible, huh?
I thought for the dual needs, special
Take
needs,
a look. Get the
they
slide.
are eliminating the once a month.
So the dual special needs followed the same practice last year. It was a quarterly change.
Right.
For this upcoming year, I understood it to be once per month. They could change. They could enroll into or change which D-SNP they
What I heard last week
Uh-huh.
was they were eliminating that from January through, new enrollment period because people were flip-flopping around too much.
I think
That was not what I heard. So what I heard was that the reason why they've made this change and no longer have the quarterly availability for this for everybody who has LIS is because too many plans were enrolling people into plans that didn't work for them. And so this is to take away that ability to do that.
Well, I thought that was not for LIS, but for the dual SNP.
For the dual SNP, this is where we are saying we will talk about this again in December.
Gotcha.
Our understanding of that is not that that's the case. Our understanding of it is that the dual special needs people do still have a monthly, and in fact, they have an expanded monthly ability because they can also go into a D-SNP as well as being able to change to original Medicare. But we're not going to worry about it. It's not happening now. We need to get through annual enrollment, and we promise we will talk about it when it's relevant.
at length
At length.
with charts, maybe.
Yeah. Maybe animations.
Maybe. Okay, so I think that's it for me for Oh, come now, move over. There we go.
Yeah,
I'll turn it
so
over to Christine.
here's another one where we're not going to go into it deeply because we don't need to. And this is something that last week they really did a deep dive into this. I don't think we need to do it. They did a deep dive into the plan smoothing. Again, I don't think we need to be the experts on this. We need to be the experts on giving people good plan comparisons for their prescription drug plans and for their Medicare Advantage plans. If it's a question of plan smoothing, they should talk to the plan. If it's a question of the Postal Service, they should talk to the office. Let's see, I have it up here someplace, right?
Office of Personnel Management.
The Office of Personnel Management. And that's why I included that little link there. Not that I expect all of you to study up on it, but that I expect if somebody is calling up from the Postal Service, that you give them that link or you give them a phone number for the Office of Personnel Management. This is above our pay grade and it is brand new. So we don't know how it's going to shake out. As far as I can tell, very briefly, it seems to be somewhat similar to TRICARE in that they still get most of the benefits that you get with a federal employee health benefit, but their medical benefits are going to be tied to them having to enroll in Part B of Medicare. And that's absolutely true for everybody as of January 1st. The people who are already covered, people who are already retired, and their eligible family members do not necessarily have to enroll in Part B. However, there could be some real difficulties down the line. We got really into that last week as to some possible difficulties down the line. Again, that's not something we have enough information to talk about. They need to talk to the Office of Personnel Management.
And move them along.
Yeah, so basically with somebody who is getting the Postal Service health benefits, they are not going to be doing comparisons with us.
Right.
They are going to have a whole different set of plans that we don't have access to at all. So really, the only thing that I would think that we would be discussing with them is making sure that they contact Social Security to enroll in Part B during their initial enrollment period.
Yeah.
And if they, for some reason, have missed that initial enrollment period, then we send them the same thing we usually do where somebody misses their initial enrollment period. They do have the general enrollment period starting January 1st through March, and they can enroll in B during that time. They did have a special enrollment period for those people who were already signed up. However, that ended yesterday.
Oh.
So really, there's not much that you should have to do. If you do feel like there's somebody that you're speaking with that needs more information, send them to Jordan or me. But really, the first place that I would say send them to is the Office of Personnel Management. Thank you, Nancy.
Can I, one question, just a confirmation more than anything else? So Part A, we do not enroll anyone in Part A. We send them to Social Security. Part B, we do not enroll anyone in Part B. We send them Social Security. Standalone drug plans, yes, we can enroll people in standalone drug plans. If they have questions, we can send them to the non-member number. Advantage plans, we can enroll them, but only after they have checked with their physician and other providers to be sure they're on the plan, but we can enroll them. Medigap plans, we do not enroll them. Am I correct?
That's an excellent summary. Thank you very much.
All right.
Could you send that to us?
Just getting to the
What
basics
I
here.
had actually was trying to put in my head, so thank you very much.
Okay, we will not put that on Leanne. We will send that out.
There are two addendums that I would probably add for a Medigap. We still can do the comparison. Just make sure everyone knows that's available through the SHIP TA Center. And then for Advantage plans, the D SNPs, the dual special needs plans, we cannot enroll in those. But everything else is fair game once they've checked with their physician. So Top marks, Leanne. All right.
Got some smart people in the room, I have to say. You really do.
So we are going to have our second annual AEP event here in the office, and we're hoping to fill it up. I haven't checked today, but as of yesterday, we had one person of 40 who have signed up. So if you're doing any counseling and someone is saying that they would prefer an in-person counseling session and they're in Davidson County, perhaps recommend them to come to the November 1st GNRC AEP event. You should all have in your packet that I've handed out. And for those attending virtually, I think Rebecca emailed it out earlier this week, a flyer with all of our AEP events on it. You can give people the phone numbers to contact to sign up for a senior center near them. And they can go to gnrc.org/Medicare sign up to sign up for an attendance slot at our event. So kind of push the event if you can, because we'd really like to try to get all 40 slots filled up. To that end, hopefully January 1st, no gosh, not January, hopefully November 1st, we're going to need a lot of help here in this office that most of you on this meeting are in now. We've got a couple of roles for people. We'll probably need a few people to help Medicare account setup. So if you're not too comfortable doing plan comparisons, that's a-okay. You can just help people create accounts on Medicare.gov and load or double check their medications. But if you are interested in doing plan comparison, we'll have a team in this room that can help people in person. And we had a pretty great time last year for the 11 or so people that came. And if you do volunteer, we do provide lunch. So please come out, let us feed you. Let us have a good time together. Christine, anything I'm forgetting there?
Sounds great. Sign up now.
Sign up now. Other AEP events, we have a number of other events. That's all on the flyer there. We shouldn't be signing people up for those. We should give them the phone number and have them call the center. The centers have been given their own set of instructions. If you do sign up for an AEP event, please bring your laptop along with us or along with you. Either Christina or I will help with the little printer that we can bring, or the center will have a printer available for us. Once you get there, you'll be given a worksheet, a sign-up worksheet, and then you just work through that worksheet as the day progresses. And most beneficiaries that come to these already have a completed worksheet, so it should be pretty quick. Usually we turn these around in 35 minutes or so. And then we'll have the center Wi-Fi ready for you when you get there. But for most centers, we get that in advance because they're really kind and good to work with. Okay, I think now, unless anything to add there, Christine.
Same thing. Sign up today.
Sign up
Sign up to work one of these events today. Or multiple.
To that end, I think, Rebecca, I pass it now to you.
Where am I driving?
Where are you driving?
I mean, do you want me to show live?
Your call.
That was my intention, and then just have the slides for your reference later on.
Okay.
Yeah, I was going to show you how to sign up for events in the volunteer portal, unless everybody's like, we've got this. You want to see it? Yes? Okay, we'll do it. So I put some screenshots on the slides here for you for later on, but let's go. I don't know, is this clickable? See?
Should be clickable.
Looks like it's taking us there. So here's the volunteer portal. Does anybody want to sign up for an event right now?
Yeah, we were hoping that you would take a look.
As an
Take a
example.
look at that sheet. Think about November 1st. Has anybody not signed up for November 1st who intends to go?
I've already signed up for that one.
Okay. Anybody else? November 1st is very close.
I haven't looked at the other centers.
Okay, no takers. We'll just do a
Got my calendar, I guess.
Oh, you'll need this, won't you?
I guess so. Yeah, I can't sign in with them up. This keyboard is so different.
Isn't it?
You have to really pay attention what button you press. Okay, see, I did not do a good job with that. I will try again. My name is right up there, right?
Yeah.
I can't use this keyword again. I'm sorry about this. Why is it not working? Is it on App Store or something and I don't know it? It's not, right?
You
Probably.
can double check by clicking where your username is and just hitting something.
don't know.
Yeah, it is on Caps Lock. That explains it.
Yay.
Okay, let me. Alicia, can I use you as a guinea pig? Sure. Ignore this. I'm gonna sign in as you. Because my view is very different and I don't want to confuse y'all.
Here I am. A lot of Alicia.
Oh,
the new
identity.
Is that you upload your own?
I,
Did you upload your own photo?
No, that's the one they
Yeah.
took.
The one they took.
Somebody uploaded that.
This
That's the
looks
one.
so professional.
So
Oh.
first step, when you want to sign up for anything, sign into the volunteer portal. And then once you're signed in, you can use those links that we keep sending you out with the actual event links if you want. Or you can also just go in here and find them all. So you would go to opportunities. And then the easiest way to only see SHIP opportunities will be filter by program. And then you select the GNRC SHIP program and hit search. That way it's only going to show you SHIP opportunities. And then you can kind of go in here and browse. Usually we try to put the date into the opportunities so it's easy for you to know, hey, I'm available or not. So let's say you want to sign up for this one right here. You just click on it. It'll show you a little bit more details. It'll show you the location over here on the right, so you can see if it's close to you. And usually has some things like it's not outdoors. All the AP events are going to be indoors. So you're going to need to have a computer, so don't need to worry about that. And then you can either hit this button or this button, or even the button up top. They all tell you respond. So you have 3 options to respond. This one still has a spot open, so we can respond. If you have any notes for us to know, like, hey, I need you to bring me a computer, or whatever it may be.
For instance, if you're account creation only, you're not comfortable doing a plan comparison, that would be a perfect place to put that there.
Let us know, because it'll like send us an email response and we can see that right away. And then, so let's say, can do everything, I'm gonna say.
I'm not sure about that, but okay.
And then you just hit submit down here. And giving you a little thing. So if you want to add it to your personal calendar, you could do that. Just add to calendar and it should show up on there. It will also send you an email reminder. I believe it's 5 days before and 3 days before to kind of make sure you have it. So if you at that point would need to change something, or tomorrow you realize, oh my gosh, I can't not do this opportunity anymore, you can go in here and manage your responses. So click on that. So right now you have responded with yes, but you can, I think you can untoggle this to no. Or you can go what I think is maybe easier. It's usually, you don't have it up already. You can look at your opportunity responses. So you see all the things you signed up for. And which one did I just respond to for you?
Forward, J, turn.
Yeah, this one. So here we can say, oh, I'm actually no longer available. So I can click unregister and it'll send us a message that you can't attend anymore. Also, after the event, you could go in and add your time here if you'd like. So I'm going to unregister since you don't actually attend this.
Yeah. I saw the Encore room was closed, Christina. Does that mean someone else signed up? When she was going through the list. I'll talk to you afterwards.
Yeah.
The one
You'd have,
that's.
she has to take a look.
This has one spot remaining.
Yeah. Oh, okay.
So
Oh, you know what? It might have showed closed on my list because I signed up for it.
probably
Maybe that's why.
could be.
Okay.
Yeah.
It seems odd. Okay.
So yeah, if you want to go in here and add hours, just, after any event and you don't want to go look at the events first, you can just go hit the add hours on top. And then it'll come up with this. And you can select here in the drop down what opportunity it is that you are signing up hours for. So only things that you have responded to, you will be able to log hours for. So if for some reason you're trying to log hours for something that doesn't show up, it means you forgot to register for it first. Then it won't show up right here. And then what we need from you is just the date that you worked and how much time you spent. You can include the miles. We don't really do much with it, but if you'd like to do that. And then in the description here, it's helpful, for these kind of events where it's like one specific AAP event and it's already in the title, you don't really have to put any notes, but let's say you're entering training hours or something like that, or you have any other notes like, hey, I drove and brought supplies back and forth, then it would be really helpful if you just put a quick note in the description what this time is for. Usually you should only be logging hours for yourself. The only time you would be logging hours for somebody else also is kind of for mostly non-SHIP opportunities. Let's say you're writing letters and you do it with your family, but your family is not in here because you're working with little children or something like that. That would be the only time. Otherwise, for events that you're attending here with SHIP, just log the time for yourself, even if, Alicia and Julia maybe were there, but then Julia will add her own time for herself so that we don't duplicate hours in the system. If you had to upload a file here for a training, you can do that, or any beneficiary stuff you don't want to upload here. So it's just for your own training. If you have a certificate or something like that, you can upload that here. And it'll let you upload one file per entry. So if you have lots of documentation or something, just send it via email. And then you just hit submit our entry. Any other things I can show you while we're at it? Anything you're not sure about, want to see? That covers it, right? Was there anything else?
Oh, when you're doing events and you're entering your hours, you know that in STARS, you can add your travel time. You can add your travel time and the volunteer portal as well. One of the things that we do at the end of the month is match all those reports together, so all of our information is correct when we send it on to the state and feds. So if they're consistent across both, it really helps us out. I think as far as the volunteer portal, though, that might be everything.
Yeah, and if you are not logged in, you can still look for the opportunities. You can see them here, but then before you can sign up, it'll prompt you to log in. So it's associated with your account. So right now I'm not logged in. I can still click on respond, but see then this pops up to just put your user information. But anytime you have questions or you're struggling with uploading something or putting in your hours, feel free to reach out. I'm always happy to help with that.
All right, give it back. Thanks. All right, a little bit more, and then we're gonna move on to very end. So courtesy calls. During annual enrollment, very frequently we'll get a call that says, hey, I'm gonna start Medicare in February. And that's great because that person has a lot of time to do things. But we have other people that have a pressing time frame, right? They've got to be enrolled in a new plan by December 7th. So we call these the magenta calls because of tradition, I guess. Because of tradition.
We colored them magenta. So we do.
It was a spreadsheet in
Yes.
Google.
Yeah.
It was just that column.
So we continue the tradition. If you're working on the call log and you have someone who really doesn't need help until January, or really needs help after annual enrollment, there is a toggle that you can call Magenta. Actually, I'll put it as Magenta. Just call that person, explain the relevant information. So if they're going to be like retiring in February, you might say, you know, in November, reach out to your HR to let them know that you plan to retire. Also reach out to Social Security to enroll in Part B and all that good stuff. And then let them know that we're going to get back to them after annual enrollment ends. The beneficiaries we talked to last year, and there were only 20 of them or something, are all very understanding that other people have a time frame that they really must meet. But then just copy and paste that call from whichever cell you're on into the Magenta tab in the call log. And just when we get done with annual enrollment, go into that tab and follow up with the people that you need to follow up with.
And you don't have to be the one to follow up with it. If you're relatively new to volunteering and you're wanting to do courtesy calls, but there may be some things that they need that you're not comfortable doing, we can follow up on those. We're usually done with them by the end of December.
Yeah, typically. Okay. So I think that might be it for the big annual enrollment stuff. So we have a few loose ends that we can work on. First, some people might need to take their recertification test. If you've taken your test this year, instead of new volunteers, you're free and clear. You don't have to worry about that at all. People that have not yet taken their test this year, we have a chance to go over some of the review topics if you need to. And then also we can do, or we can help you take that test either in paper or online. If you have any technical issues, so if your Teams isn't working or you need access to something, we've got the rest of our time together to figure that out. And then third thing, which is escaping my mind. No, just the two things. All right, never mind.
I want to
Two-
go back to looking at the plan finder.
that's what it is. Thank you. That's the third thing. I was right. But if no one has tech issues and no one needs help recertifying, then we can spend some time together looking at Medicare Plan Finder. So I want to check, has anybody not taken the test this year?
Yeah, definitely.
Oh, yeah. Do you two need a refresher on Medicare?
I don't think I need the refresher.
I did reserve the other room, so you two could just go over and.
And I think Bob has a technically that he wants.
The other day,
You did?
online, yeah.
Okay, will you send me a certificate because I cannot see them?
I don't think they sent me one.
And you might have done, I didn't, usually I get an email notification, but sometimes when people do the test portion, but not the confidentiality portion check,
Which doesn't.
then it doesn't go through. So you might have to log back in and just check that. We can check it in a minute here together, just make sure it's gone through. And I think you guys are good. You're good. So yeah. And online, I don't know.
I promise, I'll get it done.
Yeah, I'll get it done online. We don't need.
Okay, you don't need to be ushered into a separate room and
No, I'll
have the
go-
door
I'll-
closed until you do it.
Yeah, just remember when you do it, download your certificate and email that to me because somehow we still don't have access, so we'll never get access, you know.
Who knows? Okay, so if we don't care about recertification, let's see, does anybody need any technical assistance? I know, Tom Hanks, I'm going to be sending you a couple of links that you asked for.
Yep.
New volunteers that need a refresher or maybe their initial introduction to STARS or the teams. We can schedule a time to do that separately, either all as a group or I can probably do individual ones. I'd prefer as a group though. So maybe I'll send out a doodle to see your availabilities. How would that work? Okay.
That's right.
Let me go ahead and collect a list of the people that were on the call. I think Steve, you'll probably want that because you did days 1 and 2 virtually.
Yes, sir.
Yes, sir. I'll add you. And I've got Julia, Alicia, Trish, Sarah, and Beth. Okay, then I'm going to reach out to you all and suggest a few times for a Teams meeting. If not, all of you can do one time. That's okay. I can break it up into two, maybe three, but just the bulk hopefully would help me. Anybody else want to be added onto that?
Yeah, Jordan, if you would add me to that, please.
You got it.
Thank you.
Add Leanne. Leanne, there's a new Leanne that works for the state, but she spells her name like big L, little E, big A, little N, little N.
Oh, so
And
she misspells her name then.
Every time
Just kidding.
I just send her an email, I use your name and I'm continually frustrated that it's not coming up correctly. Maybe I can use her last name.
I'm also having trouble, Jordan, and I mentioned this to Rebecca at the meeting the other day, but we can connect offline about this. I've lost my Outlook for some reason. I'm unable to get into.
Yes.
So that might explain why I didn't respond to something recently.
No, that's totally fine. I think there was only one thing, but I took care of that.
Oh, thank you for letting me know you lost your Outlook. That explains something. Okay. Thanks.
Okay.
All right, then I'll reach out to you 7 for a training there. If anybody else has any technical issues and they would benefit from help in person, I'm free for the next 39 minutes, but longer if you want more time. If not, we could poke around in Plan Finder together. Any in-person tech stuff, we can go to the other room. All right, rad. Well, before we get to Plan Finder, let's do questions and answers. We went over a ton of info in a pretty short amount of time. Does anyone have any questions or want clarification on anything? Yeah.
But can you send me some practice worksheets so I can play with those?
Yeah, let me make a list of practice worksheets to send out. Trish, I've got you on here already.
No, I'm just overzealous.
I say Trish has already done the 3 that I prepared, so I've got to find more to send there. But we've had some plan comparisons that have come in mailed to us already. So the thing I'll probably do is just black out their personal info and send it to you straight. Okay.
Absolutely.
Yep. So then I'll send practice to Alicia, to Julia. Okay. Anybody else want practice? Beth, you got it.
Yeah, I'll take it too.
And that's Steve.
Yes.
Of course.
Me too.
Okay.
That's Leanne.
And Leanne. All right.
Thank you.
Sure. So I'll send those out. And because these are just practice ones that are entirely hypothetical, they include no personal health information. I'll send it directly to your personal emails. And I'll do the same for you, Trish, once I've blacked out the identifiable stuff. That'll be safe. Because again, best practice, if it's got actual protected info, we only use the ShipVol account, which I'll talk to many of you about in a separate training. Okay. Any other questions before we maybe poke around at Plan Finder for a bit?
I've got a couple case questions, but so do Plan Finder.
You said a couple case questions, so for
Yeah,
beneficiary?
Call questions, so.
Okay.
Plan Finder. If we don't get them done, I can email you.
Okay. Well, then let's play around with Plan Finder. I gotta say, I've been really excited for this. Let's see what trouble we can cause. All right. Oh, come on, mouse. There we go. All right, what do we want to do first? Let's just start over and add some wacky drugs and really test what this will do. We'll choose 2025 plans. So that'll be the bulk of what's going on during annual enrollment. Anybody have a zip code they want to test for, or just, all right, keep the office. We'll look at Part D together. Find plans. No extra help. And we've got those 3 meds. Let's do some wild stuff. Who's got a crazy drug? Ozempic. We'll see. There's a lot of calls about Ozempic.
Oh, I'm sure.
Add to my drug list. Maybe we want to add Wegovy as well. And, oh, that's interesting. I don't think I've ever had a drug not suggest a dosage before. All right. 4-pack a month. And then, what, Eliquis? And Apple. Just tartrate, which I think is the non-extended release. Nancy says yes, so it's true. All right.
Succinate is extended.
And I think that's enough for us to hit 2,000. What do we think? Probably. If not, we'll go back and add Xarelto or some other crazy thing. Let's check CVS. Okay. That's enough big names. And this is interesting. I don't recall last year it saying there may be advantage plans with lower drug costs. Is that new? You think that's new?
That's new.
Yeah,
This is gonna tell me more link to.
let's find out. Side. 46 plans in the area.
So the basic just tells you, it can bring you to the MA page. Okay.
Yeah. I wonder if you're doing advantage plans, if it tells you about Part D.
Probably not.
Probably not. Oh, with thumb on the scale again.
Some on the scale.
Okay. Let's clear these guys out. Do the 3 lowest. Yeah, we might have to remove a medication. I'm anticipating something's not covered.
I'm guessing something's not covered.
So it always comes up, the lowest amount price.
Yeah, it
Okay.
defaults to show us the lowest drug and premium cost for the next year. Which premiums they give us right here, deductible. A lot of people get hung up on deductible, right? They think they've got to pay the deductible before anything happens, and that's not correct. What's really important for people to look at is the total drug and premium costs, because this is everything that they'll have to pay with regards to their medications. Wow. All right, let's figure out what's not covered. We'll go to the plan details and it'll show us. Wegovy, you think?
I think so.
Well, it didn't give us a suggested dosage, so I bet you're right. Let's see what we've got.
There
Yep,
it is.
there it is.
It's bright yellow. Wow.
Bright yellow, not covered. Dang, that's a lot of money.
But Ozempic is covered and it does the same thing, right?
They do similar things, but
So it's not.
not exactly.
I think the dosage might be slightly different too.
Yeah. I think Ozempic may have been on the market longer too.
Yeah.
So it's had a longer time to go through the Medicare drug negotiation.
And Wegovy is just for weight loss.
Is it just for weight loss?
Yeah, so it's not, you can't write a prescription
Okay.
for like type 2 diabetes for it.
Because
Whereas
Ozempic,
Ozempic technically is both, right? It does the same thing, but it's,
for Medicare coverage, it has to be prescribed for the diabetes.
yes.
Medicare won't cover something
And
and
that's why the
Yeah.
Wegovy is, because you can't write a prescription for Wegovy.
Interesting.
It's a type for diabetes. Huh?
It's interesting that it even pulls up.
I guess just to highlight that it's not covered.
Correct.
There are lots of other things that aren't covered that don't even pull up.
Yeah,
Probably so they just don't get the question of like, are you gonna add it?
Yeah.
maybe.
Yeah, someone's
Like, oh, you know what's new, when are you gonna?
yeah, I want it, but that's why, it was sort of a happenstance that, that the Ozempic.
I don't know. Switch over to Medicare Advantage plans and see if they cover it.
Yeah, sure.
I doubt it. Because it would be the same, would it?
Yeah, but it would be very weird to have something that's never covered.
It might cover it.
Well, I mean, it's just like if, I don't know, I'm not a medical person, but I'm assuming if you have some medication or something that's for more
I'm,
aesthetic,
no, I'm not talking about,
Right.
I'm not talking
but
about,
that's what. the
I'm talking
code is
about-
Considered.
yeah, but I'm talking about Medicare. Medicare usually doesn't bother to put something in there if absolutely nobody's going to cover it.
Yeah, I
Well, I
bet,
guess if you're in like you're like morbidly obese and you're under a doctor's care, they might be able to wiggle some kind of prescription for it, right? To help you lose weight because you have some other,
no,
no?
Medicare
nothing like
doesn't
that?
cover weight
Oh,
loss
sure.
drugs. But I bet Julia's onto something. I bet it's in the negotiation pipeline.
Yeah.
So they
that
went
would
ahead
make
and added it.
sense.
Yeah.
So they put
Which
it
is
in
why
there
I
so they
didn't
didn't
have
have
the
to.
default.
Yeah.
Which is interesting.
Ooh, zinc.
Oh, there you go.
Yeah, it looks like it's not covered though.
I'd be surprised if it is. It looks like it's got better coverage for other medications. I wonder what their provider networks are
I
like.
think like UHC covers it. I'd be interested.
Oh, yeah.
I could see them maybe doing a gamut on that.
Oh, here's something that we didn't really talk about. When we're doing a comparison for Advantage plans,
Hmm.
sometimes people will say, I want to only look at HMOs. Because often HMOs have the best supplemental benefits because they have the smallest provider networks. Or sometimes people will say, I only want to look at PPOs because they want to have some coverage out of network, even though it's going to be lesser coverage. They want some coverage. Sometimes they don't tell us anything. If they don't tell us anything, I usually do one, like the cheapest HMO, the cheapest PPO, and then the next cheapest whatever. Sometimes if there's an HMO POS, which is an HMO with some coverage out of network, I'll look at that too. But most of the times I'm talking to the beneficiary or I've got them in an email or something and I can ask them, what am I going to look at? Really put as many decisions on the beneficiary as you can so they get what they want. All right, let's check these plan details. I was actually kind of hoping that this would be updated for the 2025 Part B premium, but it doesn't look like it has been yet. I don't think we got that until, I guess, the second week, maybe the third week of October last year. No,
And it's, you know what it's going up to?
no, we don't know that yet. CMS hasn't announced it.
I saw something the other day in there, it was talking about 180 or 184, something like
Okay.
that.
Yeah, well, Gobi's not covered. Interesting. But I think maybe Eliquis has more coverage. I thought it was 300 something on the other one. All right, well, let's back out. What I want to do is remove Wegovy and then just flood it with other medications so we can get to that $2,000 cap and see if it shows us in an anonymous view. So not logged into somebody's plan or somebody's account, if it'll show us anything about that payment plan. Excuse me.
One. Congestive heart failure.
Okay. And is everyone pretty comfortable with how we add, edit, and remove drugs from the drug list? It's pretty easy to get the hang of. All right. What else should I have done? Atorvastatin, simvastatin. I need help figuring out these drugs to add. Somebody throw drugs at me.
Try Jardiance.
Oh, of course. Mentioned that earlier, didn't we?
And I'm
Thank you.
trying to find one here. There's one I'm thinking of. It's for heart, congestive heart. It's one of the new that is negotiated. But I can't think of the name of it.
Xarelto,
No,
Januvia,
no.
Novolog, Humalog. Trying to bring into mind the chart of negotiated drugs. Let's see if Jardians gets us there. Others.
So, the FDA earlier this year approved Wegovy for an additional medically accepted indication to treat cardiovascular disease.
Oh.
So that's why it is now eligible to be covered by Part D, if it has that specific use specified.
That's cool. Alrighty.
Yeah.
I'm just.
You could try ARNIS. I don't know. That's not the one I was thinking of. Interesto.
Okay.
Interesto.
I'm sorry, I'm shocked at this. Because this is only saying $475 for the year, but I added a couple of heavy hitters. Wow. Is this a new price for Jardians? I'm used to like way more than that. And Xarelto's been slashed. $140 a year for Xarelto? Now that's really interesting. I need to spend time or pay attention to what's considered a high-cost drug now.
What are you considering high cost?
Something that in the last couple of plan years cost $200 a month or so.
Probably you only get twice a year, but it comes in at $1,600 to $1,700 a pop. I don't know if
That'll
that
do.
would. And that one you only put in for every 6 months.
Okay. Let's see what that's done. You said that's 1,700 a pop?
Yeah, depending on where you get it. Those are the numbers I've been seeing. It's the retail cost.
This is what I was expecting to see earlier. Wow.
Very interesting.
730 for the year. I'm gonna swap back over to Part D.
You know, I wonder if these figures that we're seeing, because they don't really look right, are going to hold. Because what I've noticed in the past, between the 1st and the 15th,
Some change.
Changes.
things
a lot of things,
things
yeah.
change.
Okay,
Because the plane providers would probably start
There, that gets you over.
making some
Yeah.
decisions,
that makes sense.
crunching the numbers.
No, I'm not seeing a badge that talks about the payment plan anywhere. Oh, and here's a good example of why we need to choose which.
There,
pharmacy.
it's down below. There you go. Right down, see that blue line, that dark blue
Oh, yeah.
line?
Keep going.
Oh, I see, yes. So it's below the yearly drug costs. And then this becomes highlighted in some color, probably blue.
That's the highlight there.
This is the
Other
highest.
screens, if they're not eligible, that information is, that box is going to be there. You're not going to see the blue line and you're not going to see that logo.
Oh,
Okay,
I don't consider that a highlight exactly.
I don't either.
So we've got, I've seen this one. This is where, oh, this is cool. They mentioned a wizard last week. This is what they consider the wizard. It'll ask you questions. So do you get help with your drug costs? We'll say no. This is screening for the low income subsidy. We'll say no. My drug costs are consistent and affordable each month. It says probably won't help you. You can start over. No. They change. Yes, it's probably more than $2,000. I think I'll hit it before September 30th. Yeah, payment plans. Oh, okay. So you can toy around with that. So that's this link. Find out what the drug costs might look like with this payment option.
Yeah, no, this is helpful.
Oh, but I see what it's done.
Yep.
This is for this pharmacy, but this pharmacy is out of network.
Got it. So it would be,
So, oh, that's interesting.
so it just did the math.
Now, this isn't correct. This isn't correct. So this is assuming that all of the drugs are covered, which
Yeah.
none of them are because this isn't a covered pharmacy. So that's a really good
That's
thing.
And
Oh my
gosh, you
gosh.
should report that. for
Oh my
sure.
gosh, that's huge. So when we're looking at the payment plan, it's important to not look at any pharmacy that isn't covered.
Yeah, because they don't catch that.
And even here, this is incorrect math.
That's
That's
not at all
incorrect
what we
math.
were told was going to be happening.
So I'm getting, this is Tom. Go
Hey,
go
Tom.
back a little bit. I'm getting confused. Why isn't the very bottom not equaling out? Why didn't the? Why
Because
the-
it's
why
right.
did the, go ahead.
It's wrong.
It's wrong.
Because without this payment plan, it's correctly identifying that you're going to be charged this much each month because it's going to be full retail price. The Kroger that we're looking at here is
Out of network.
out of network.
Yep.
So it's not giving us correct pricing
Oh, okay.
in the payment plan.
So you need to find one that's in network.
Yeah. so we
Exactly.
switched
So, or preferred.
Exactly.
So let's
Switch.
switch
And
to
it's fine.
Walgreens.
Fixed it,
I
yeah.
wonder if the issue that they have is they're looking at if the drugs are covered, but not if the pharmacy, I think they're just leaving out the pharmacy being in network or not.
Yeah.
Yeah.
It's assuming since the drugs are covered, that it would be.
But that's crazy though, that they're doing it for the left and not for the right.
And even then, the math on the right is incorrect. That was a full perfect spread of 2,000 divided by 12.
Yeah.
Hold up, I'm making a note.
Not the actual cost, but the cap.
Feedback for the wizard.
So is Walgreens considered an in-network pharmacy, a preferred pharmacy under this example?
This Walgreens, I think, said that it was an in-network, but not preferred. And this
Okay.
math
Well, let's
looks
look,
correct as well.
We put the Prolia in there at every 6 months.
Uh-huh.
It's only showing one number. Again, I'm thinking this type of thing
Yeah.
is what is probably being fixed in the background.
Oh,
Yes.
Sure.
Because again, this is day one. They got to get it up there one and then go back
Yeah.
and
This one have it at total at 1,800 instead of the 2,000. Is there a max out of pocket that's different for this plan?
Yeah, and this is very strange
No.
because it's not
No,
really
it would be
deductible in January
Okay.
in the full amount. This is very weird.
Are we fortunate enough that we can split screen this? Oh, nice. All right. So I made a little toy and I'm certain that the math is correct on this. On this here. 9650, 9650. Okay, yeah, that matches.
Yeah, because if you go back to what the cost was 1,800,
Uh-huh.
not 2,000.
But I don't know why it's 1,800 instead of 2,000.
Yeah.
Because the total out-of-pocket max should be. Oh, you know what?
No, it was because of the.
After the deductible is met, then the plan pays more money. So the true out-of-pocket cost might not get to $2,000. I wonder if that's what it's calculating. Because after certain points, first the plan pays money towards the copays, and then the manufacturer pays money towards the copays. So I wonder if this is reflecting what a beneficiary will actually see.
Okay.
So this year, the catastrophic coverage starts at about $8,000, but the person doesn't pay the full $8,000. I think the true out-of-pocket this year is around $3,600. So if this is the case and it's calculating what the plan is going to pay, then I'm pretty well impressed. But I don't know if I have a way to verify that.
Wow.
So now let's look at the preferred pharmacy. But a different. I would have suspected if it was calculating what the pharmacy, I'm sorry, what the plan was contributing, that it would give the same. Oh, no, but it might not, because different pharmacies have different negotiations for medications. So it could be that this pharmacy, even though it's preferred, might be charging more for some of the drugs, which means the
we got to go back.
share of costs is different.
See who's paying
Okay,
what for. what.
well, let's double check. It appears to be correct, but I want to verify this. This is so exciting.
You need to get out more, Jordan.
Oh,
I'm just
yeah, I
joking.
agree.
I'm joking. I get you.
Okay, yeah, it seems to match. So I think I would say Plan Finder makes sense when it's giving the estimated costs. But,
Not for making these kinds of.
right.
Go back.
Jordan,
Now, is it,
one,
yes, Leanne?
one thing that I've read and heard that is important to point out when you are doing plan comparisons, and people might be interested in this, is to emphasize that this is not a cost saver.
Right.
Right.
The
Yeah.
plan
Right.
is not,
just-
it's just, it spreads the cost or it smooths the cost, but it's not a cost saver.
That's correct. And I think I've identified why it costs more at CVS. In the drop down, it gave Walgreens first and then CVS. So
You assumed that was.
I got it
Yeah, they were.
backwards.
Yeah.
But here it shows us that Walgreens is preferred, which is why we saw the 1801 instead of the 1880 something. So preferred pharmacies would have it cheaper.
I have had situations in the past, and I tell the people, I can't explain it, you gotta call the pharmacy.
Yeah.
The pharmacy they want to use is in-network, but it's
Yep.
not preferred.
Yep.
But in-network pharmacy is lesser expensive than the preferred pharmacy.
I've seen that too.
Mhm, same.
And I just say, this is all I can do, you call the pharmacies and talk to them.
Yeah, Beth.
So what's the difference in terms between preferred provider and network?
So in-network is one of the plan providers' buddies, right? They're good friends. They get cheaper prices than out-of-network pharmacy.
Okay.
A preferred pharmacy is not just the insurance company's buddy. They're like BFFs, best friends. And so
Generally,
they
your preferred
generally get
pharmacy
much
is going to be lower cost.
Okay.
99% of the time, but if you ever see, again, I have seen where that in-network, I'm like, I can't explain this to you. This is what I am seeing. Go to the plan or go to the pharmacies and talk to them. Because it just.
Yeah, it just depends on what rates the health plan negotiated directly with the pharmacy, because if they're paying the pharmacy less, they're gonna market it as preferred for them, because then they save money. So like with CVS, CVS owns Aetna, so you often see that they have a pretty buddy-buddy relationship.
Yeah.
Yep. And they prefer you to.
But Julia, do you know why sometimes things cost less than an in-network rather than a preferred?
Not everyone's good at their jobs, is the best answer I can give you.
That's one way to put it.
Like I've seen, like UHC, for example, owns a lot of providers and they're really bad at integrating. I used to work at Optum, which is one of UHC's sister businesses. They're really bad at integrating. And so like where a lot of synergies they should really capitalize on, they just don't. And like sometimes they're just not paying their own providers as much as they probably should be. Like,
It all goes into contract negotiation.
yeah.
That's the
some
answer
people
to
aren't
the
good at their
question.
jobs.
Well, it's contract negotiations and like you said, how they integrate to even know.
Yeah.
Right, because
Yeah.
they could.
Yeah. CVS and Aetna are pretty integrated, I will say, on that end at least.
I just want to check what Walgreens is charging. different points, because after you meet your deductible, then the plan starts paying more. And it seems like for these drugs, which I think the plans paid less for last year, the after deductible charges way more comfortable. $800 for Prolia after deductible, is that
Yeah.
okay? Now, this is what I'm kind of surprised by. Xarelto after deductible, I thought was a lot higher. But we shouldn't complain about that because that means people are saving money. Okay,
Is that one of the ones they negotiated? Oh,
it is
those-
one of the
those-
ones they
that
negotiated.
Doesn't start.
Exactly so. So drug companies get this year to continue to crank out massive profits on these drugs. But then next year, the manufacturers will have to pay more and people will pay less for some covered drugs.
So as we get closer to October 15th, these numbers might look slightly different.
Yeah, do expect some changes. It's good that we saw the plan finder. And the payment plan and toyed around with that. That's pretty neat. We've got only a few minutes left. Any follow-up questions? Any closing clarifications? All right. Well, I don't think I have anything else to cover. Rebecca, anything for you? Christine?
Thank you.
Jordan did a
Yes.
great job. This is very thorough. It really has paid off attending. Great.